Meeting will please come back to order.
Oh, dear. Sorry.
The chair, I think, has called up the committee print concerning health information technology. Without objection, the committee print will be considered as read. The clerk will designate Section 1.
Amendment in the nature of a substitute to committee print. Title 3, Health in...
The chair has an amendment in the nature of a substitute, which I will offer at this time. Okay. It contains minor changes to the text, primarily technical corrections suggested by the administration. Our staff has been provided with a document summarizing the changes. The
Mr. Chairman,
yes.
Have we had this available to us?
Yes.
When did we have this available?
I believe so. Do I have the amendment in the nature of a substitute?
Well, I'm going to reserve the right to object until we have a better idea of what we're talking about.
Okay, just one minute.
Oh, I'm sorry.
It's all right. You can do it. Reserving the right to object or parliamentary inquiry, Mr. Chairman.
Gentleman states
Mr. Chairman, you and I have been in discussions to try to expedite the rest of the evening. Does the manager's amendment in the nature of the substitute that you've just put before the committee reflect our gentleman's agreement on amendments that are going to be offered, and specifically does it provide germaneness for the Gingrey and Burgess and Whitfield amendments on doctor reimbursement fixes? Mr. Chairman, did you hear my parliamentary?
Yes, Mr. Barton, your inquiry goes to the heart of the matter. We do have an agreement on how we're going to proceed. I will offer an amendment in the nature of a substitute, which has, I believe, been shared with you. It was our first amendment in the nature of a substitute.
It's the one to which all amendments have been drafted to. Is that correct?
That's correct.
Okay.
And if they're not, we'll allow them to be
and
made.
We are agreeing with that as the base text to allow an amendment by unanimous consent to fix a part of the health IT title.
That's correct.
Which you'll have to add, which we will agree to.
Yes.
We are also agreeing, because of your agreement, to put that text into as the base text to be considered for amendment, that we will pare down the number of amendments that we were going to offer, and on each amendment we will only have a debate of 2 minutes on each side.
That's correct.
Okay. And we are preparing to make sure that both sides have all the amendments, and so that members will know which amendments are going to be up.
That would be helpful.
So we are in agreement, Mr. Chairman, and I withdraw my reservation.
So without objection, the amendment in the nature of a substitute will be considered as read. The what is the statement you want me to read on the nature of the substitute? Can you do a theory of The title as amended contains many essential policies that will allow this country to fully realize the promise of health information technology exchange, including improvements in health, reductions in disease, improved patient safety. And without objection, my full statement will be made part of the record outlining the amendment in the nature of a substitute. We have an IT amendment. Do we go first or do we let them go first?
Parliamentary inquiry.
Tell me whether
Parliamentary inquiry.
yes, gentleman, state his parliamentary inquiry.
You were beginning to address what I believe is Title IV. Have we skipped over Title III?
We're on the health information technology print.
Which is Title IV.
So you're going to 4 before you get to 3?
Yes.
I guess so.
Okay. Just wanted to be sure.
You want to just outline what it is? Why don't we let them do that amendment? We have an amendment on that's been agreed to, but we're trying to get that amendment together. Mr. Barton, who has amendments on your side? We'll consider them at this point.
Mr. Whitfield and Dr. Burgess and Dr. Gingrey each have amendments dealing with physician-patient formula to Title IV, and they're all three prepared to proceed at your discretion.
And you're not seeking to consider them in block, but separately?
No. We want 4 minutes of debate on each amendment equally divided.
Mr. Whitfield, I'm going to recognize you. You have an amendment at the desk. Without objection, your amendment will be considered as read. You're recognized now for 2 minutes to argue for your amendment.
Well, Chairman Waxman, thank you very much, and Ranking Member Barton for working out this arrangement for us to talk about these important issues. My amendment is very simple. Every member of the Energy and Commerce Committee is all too familiar with the problem faced by physicians on their reimbursement rates from Medicare. Over the past several years, each year, Congress has intervened and has been required to intervene in order to stop a significant reduction in physician reimbursement rates. This amendment is very simple. It simply takes care permanently for this physician reimbursement problem, and it does so by replacing the broken payment formula, the sustainable growth rate, with stable annual updates based upon the Medicare Economic Index. It is time to stabilize this broken formula. The physician community has been very vocal about the need to make this a permanent fix, and that's precisely what this amendment does. It removes the sustainable growth rate. It bases it, the moving forward, it bases the updates upon the Medicare Economic Index, which is widely used, and that is what this amendment does, and I would urge the adoption of the amendment.
Will the gentleman yield? Will the gentleman yield?
Yes.
Oh, yes, yes.
I thank the gentleman for yielding. I referenced this in my opening statement. This is the singular most important issue for the practicing physician that affects our physician workforce. The ability for us to maintain a physician workforce and deliver the care for arguably our most complicated and vulnerable patients, who are our senior citizens. I could have brought a graphic of the sustainable growth rate formula. In truth, I don't really understand it, but the very last function on the graph means that you go back for 15 years, grab all of the savings that you should have had while we've done these temporary fixes, and add it on to the end. That's been the problem. The cost of repealing the SGR is enormous because we have to go back and capture all the savings. What this amendment does is said that we're just going to reset the baseline and start all over again. Why is that critical? Well, this money is not real money. These dollars have already been spent. They have been doled out to the doctors, and the doctors have used them to run their businesses. It's not like this is money sitting in an account somewhere drawing interest. We have incurred the expense, but we haven't accounted for it on the books. If we were Bernie Madoff, we'd be sitting at home with
Mr.
an ankle
Burgess,
bracelet.
the time of the gentleman who yielded to you has expired. And I know you're going to have an opportunity to speak further on this issue in your own amendment. So I'm sorry to cut you off, but the time has expired.
I would just urge my colleagues to recognize that this is the most singular important issue facing the practicing physician today in maintaining a viable physician workforce to take care of our Medicare patients in the future. You can't pay for performance if you don't have the doctors there to do the work.
Gentleman's time has expired. The Chair will recognize himself on this amendment and express my agreement with the fact that we need to do something about the Medicare physician payment formula, and I'm fully committed to doing so. Current protections for physicians are scheduled to expire in January 2010, at which point the physician fee schedule will be reduced by more than 20% from today's level. That schedule guarantees that we must revisit the physician payment system at some point this year. However, this vehicle is not the right place for fixing Medicare physician payments. Making payments in Medicare contingent on subsequent actions by Congress is a dangerous precedent, and I feel that we have an opportunity to make a major investment in this nation's health infrastructure in this bill. We can't let that be derailed by other problems in Medicare. I do not know how much this amendment would even cost. Maybe Mr. Whitfield could give us a number on that, but I don't see a pay for, which would mean that is expanding the amount of money that would be spent in the stimulus bill to include the cost of the Medicare physician payment formula, and that would upset the whole balance of the bill, which does have strict parameters around it. I'd like to yield
Will the gentleman yield for a question?
I'd like to yield to Mr. Pallone first.
Thank you, Mr. Waxman. Look, my estimate is, since this is a permanent fix to the SGR, that over 10 years, you'd basically be talking about $400 billion, which is more than the entire infrastructure package, the entire infrastructure section, all the roads, all the bridges, everything that we're doing for infrastructure in this stimulus package, which of course is not before this committee, is included in that. I think that it makes no sense for us to spend that kind of money without any in-depth analysis of what we're doing. And we are determined, you know, in the Health Subcommittee and to proceed and address this problem, but it shouldn't be part of the stimulus. I mean, I wouldn't have it substitute for all the infrastructure projects. We're very careful in what we do in this bill when it comes to the health provisions to try to come up with very specific.
My time has expired, and therefore the time that I've yielded to you has expired. All time on this amendment has expired.
Mr. Chairman, would you yield for a question?
You know, the problem is you'll have a question, someone will have an answer, someone will have another statement, and that defeats
I must have
the
missed
purpose.
getting the CBO report on the cost of the underlying bill because I don't have it in front of me.
I see. We'll proceed to a roll call vote on the Whitfield amendment.
It's too bad.
And my apologies to the gentleman.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingell? Mr. Markey? No. Mr. Markey, no. Mr. Boucher? Mr. Pallone? Mr. Pallone, no. Mr. Gordon? Mr. Gordon, no. Mr. Rush? Ms. Eshoo? Ms. Eshoo, no. Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green, no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mr. Doyle? Ms. Harmon? Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Barrow votes no. Mr. Hill?
That replaces that.
Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, no. Mr. Barton? Mr. Barton votes aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Whitfield, aye. Mr. Shimkus? Mr. Shattuck? Mr. Shattuck, aye. Mr. Blunt? Mr. Blunt, aye. Mr. Boyer? Mr. Boyer, aye. Mr. Radonovich? Mr. Pitts? Ms. Bonomack? Ms. Bonomack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy of Pennsylvania, aye. Mr. Burgess? Mr. Burgess, aye. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey, aye. Mr. Salas? I can't see him. Mr. Salas, aye. Okay. Ms. Capps? Not recorded. Votes no. Ms. Capps votes no. Ms. Harmon? Ms. Harmon votes no.
Other members wish to respond to the vote?
Nope. No, Matthew. Did he come in?
Any other member wish to respond to the vote? If not, the clerk will tally the vote. One more is coming.
Mr. Rush votes aye. Oh, Mr. Rush votes no. Off aye on no.
And take it back.
Can't take it back. You like your aye vote. It'd actually be a good vote.
Any members voting aye wish to change their vote to no? Anybody voting no wish to change their vote to aye? Anybody wish to be recorded? Then the clerk will tally the vote.
On that vote, Mr. Chairman, the ayes were 15, the nays were 31.
Ayes 15, nays 31. The amendment is not agreed to. Before we consider the next amendment, I want to ask unanimous consent that we add the words health information technology to section 3011C. Without objection, that'll be the order.
We have no objection, Mr. Chairman.
Thank you. Without objection, that'll be the order. Next amendment. Dr. Burgess.
Mr. Chairman, I have an amendment at the desk.
Amendments at the desk. The amendment will be considered as read without objection, and the gentleman is recognized for 2 minutes to speak in favor of his amendment.
And Mr. Chairman, I thank you. Had the last amendment passed, this amendment would not have been necessary. This is a much more modest attempt to fix the projected 20% decrease in physician reimbursement that's going to happen in less than a year's time. So this amendment would stop the cuts coming in January 2010 and set a payment update of 2.7%, following the advice of the Medicare Payment Advisory Commission, and then it would set the 2011 Medicare physician payment update based on the MedPAC recommendation formula of increases to produce an update equal to the Medicare Economic Index. And very importantly, Medicare beneficiaries would be protected from having their Medicare Part B premiums increased, even though the amendment will protect physician payments from decreases for 2 years. And I want my colleagues to know that all this does really is stop the decreases in payments to physicians for 2 years and ensure the beneficiaries will not be penalized by losing physician services, and it means the physicians will be treated fairly, and that a cut which was unintended and which was a result of a mistake by the Congress will be avoided. These increases are coming as a result of the flaws in the Medicare formula created by Congress, and it is agreed by everyone who has looked at this that these increases, rather these decreases, are in fact a result of a mistake by Congress which has not yet been corrected. Now, I want you to listen to what your doctors at home are saying, and I do want to yield time to the ranking member of the full committee. If members recognize the substance of this amendment, I would just point out this amendment was offered by Mr. Dingell in 2005 to the Deficit Reduction Act, and 22 Democrats voted in favor of this amendment. I'll yield to the ranking member.
Mr. Chairman, and thank you for yielding, Dr. Burgess. I rise in very strong support of this amendment. This is the exact language that former Chairman Dingell offered when he was the ranking member during the Deficit Reduction Act debate several years ago. We had a lengthy debate at that time. 22 current members of this committee on the Democrat side voted for it, including Mr. Waxman, Mr. Dingell, and Mr. Pallone, who all strongly supported it in addition to voting for it. Again, this is the exact language of the Dingell amendment offered in this very same committee approximately 3 years ago. I strongly support the passage. I thank the gentleman for offering the amendment, and I would point out, Mr. Chairman, that when we have had a debate about PAYGO, the new majority in this Congress eliminated the PAYGO requirement, and there is no PAYGO language in the underlying print, and I'm told there will be no PAYGO on the bill that goes to the floor next week. So I urge support of the Burgess amendment.
Gentleman's time has expired. Let me just inform the clerk that the wrong amendment was distributed, and perhaps we can distribute this one, but I think the members are fairly familiar now with the intent of the amendment and what it would do. Chair recognizes himself in opposition to this amendment, not because I oppose the amendment. Certainly I support it, and I believe that when it had been offered at previous times, I voted for it. We must address the Medicare physician payment formula. I'm fully committed to doing so. We know that we're looking at an expiration of the current protections for physicians' payments in January 2010, so we have to address it. But this is not the vehicle or the right place for fixing the Medicare physician payments, and making payments in Medicare contingent on subsequent actions by Congress is a dangerous precedent. We have an opportunity to make a major investment in this nation's health infrastructure in this bill. We can't let that be derailed by other problems in Medicare, as serious as they are. Don't let the perfect be the enemy of the good. So I am very reluctant, because I support what the gentleman's trying to do, but I'm reluctant to, reluctantly must oppose it and urge members to vote this amendment down so we can address it at some other time. Mr. Pallone, do you want to add anything more?
Well, just again, I agree with you, Mr. Chairman. I mean, obviously we want to address this, and we intend to, with, hearings and attention to it over the rest of the year. But again, the health portions of this stimulus package are carefully tailored to deal with the immediate problems, and those are, people that don't have health insurance, the states that need to cover Medicaid patients because the lack of health insurance for people who are unemployed. And, most of the money in this bill goes for those purposes, which are immediate needs. And this is something that we have time to address and is not the immediate need at the level of FMAP and COBRA and the other problems of the uninsured that are in this bill. I yield back, Mr. Chairman.
Thank you, Mr. Pallone. I yield back the balance of my time. All time has expired. We'll have a roll call vote on this amendment, and we'd like to ask the clerk to please call the roll.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingle? Mr. Markey? Mr. Boucher? Mr. Pallone? Mr. Pallone, no. Mr. Gordon? Mr. Gordon, no. Mr. Rush? Ms. Eshoo? Ms. Eshoo, no. Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green, no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Barrow votes no. Mr. Hill? Mr. Hill, no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? No. Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, no. Mr. Barton? Mr. Barton, aye. Mr. Hall? Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Whitfield, aye. Mr. Shimkus? Mr. Shattuck? Mr. Shattuck, aye. Mr. Blunt? Mr. Blunt, aye. Mr. Boyer? Mr. Boyer, aye. Mr. Radonovich? Mr. Pitts? Ms. Bono-Mack? Ms. Bono-Mack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Is she here? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy of Pennsylvania, aye. Mr. Burgess? Mr. Burgess, aye. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Mr. Scalise, aye. Other members? Mr. Markey? Mr. Markey votes no. Mr. Rush? Mr. Rush votes no. Mr. Dingle? Mr. Dingle votes no.
There are members on the other side.
Mr. Radonovich? Mr. Radonovich votes aye.
Have all members responded to the vote? If so, the clerk would tally the vote.
On that vote, Mr. Chairman, the ayes were 15 and the nays were 34.
15 ayes, 34 noes. The amendment's not agreed to. Mr. Gingrey?
Chairman, I have an amendment at the desk, I think number 19.
Without objection, the amendment will be considered as read, and the gentleman from Georgia is recognized for 2 minutes in support of his amendment.
Mr. Chairman, I thank you, and I'm, of course, very disappointed that the two amendments that we just voted on did not pass, that being Mr. Whitfield and Dr. Burgess. I think they're both very important amendments, and I can assure you, as a physician member of the committee, Dr. Burgess certainly knows of what he speaks in regards to the effects that it's going to have on the provision of care. And I think Mr. Pallone talked about that this is not the place for the bill, that what we're concerned here is getting more people access to care. Well, they're darn sure not going to have access to care if all the physicians drop out of Medicare. Maybe they go to witch doctors. I'm really not sure. But my amendment, Mr. Chairman, is a very simple, straightforward, and it's one that has certainly been contingent in the past on passage of other legislation, because it is simply a one-year fix. It holds the doctors harmless and frees the reimbursement rate at 2009 levels for 2010. No updates, no increase whatsoever. It just simply freezes them at 2009 levels. And we don't need, once again, Mr. Chairman, to wait till the last minute to do that, as we've done over the last several years. So, I mean, I think this is pretty simple, straightforward. The least costly precedent has certainly been set for 1 year. Fixes in the past, a small Band-Aid, and I commend this amendment to my colleagues. Hope all on both sides of the aisle will support it. Doctors are counting on it. I yield back.
You yield to, would you yield to me?
I'll yield to Mr. Walden if I have time left.
Thank you very much, Mr. Chairman. When you look at all the other things that we're spending money on in this bill, including $200 million for the National Mall, including reseeding, I can think of a few things that are more important in my district than making sure seniors have access to health care, which they're now finding very problematic to get access because of this underlying SGR issue. And this Congress needs to step up and fix it. It would have been best done in the last two amendments, but certainly this is our last great hope. But this is about health care for seniors.
Gentleman yields back the balance of his time. The chair recognizes himself. I again reluctantly oppose this amendment. These amendments are being offered to show how we need to do more in the area of physician fee reimbursement under Medicare. It's an issue that we all can support, but unfortunately this is not the bill where we can support it. We'll have to do it in legislation later this year. And I regret that doctors have been pushed into the perils of Pauline each year, wondering whether they're going to fall off a cliff and have an automatic reduction in their reimbursement rates, which is, by the way, one of the reasons I voted against the Balanced Budget Act, which had projected cuts in Medicare that I knew were unsustainable. We have a very difficult job now to figure out how to get a permanent fix for the physician fee reimbursement. Somebody said it's going to cost $400 billion. That's a lot of money, even in the context of the way we're talking about money for bailouts and stimulus and everything else. But we're going to have to figure out a way to do it, but not in this bill.
Mr. Chairman, if you would yield to me for just a second.
Yes, I will yield to you.
With all due respect, Mr. Chairman, why not this bill? You know, if not this bill, what bill? I mean, how is this different from any other fix that we've done in the past where it's tacked on at the last minute to some other vehicle, if you will, some other legislation? If not now, when? And why not now?
If not now, when? And if not us, who? Is the way the expression goes. And I sympathize with the statement, but this bill, which has been offered at the urging of the President of the United States and supported by the leaders in the House and the Senate, has certain constraints on it in the amount of money that they've allocated for us to spend for a stimulus purpose, and they want that bill passed as quickly as possible. So we will have to do it in another piece of legislation. My time has expired. We'll proceed to a vote. So I understand that the gentleman is willing to have a vote with a show of hands. Is that correct? All those in favor of the amendment will please raise your hand, and the clerk will count. All members that want to vote, be sure to be in the room.
Put your hand up. It shouldn't take that long to count the Republicans.
Have we completed the count of those in favor of the amendment? All those opposed to the amendment, please raise your hand.
I can see that takes a while.
Clerk will report the tally.
On that vote, there were 13 ayes and 27 noes.
13 ayes and 27 noes. The amendment is not agreed to. Mr. Barton.
I have an amendment at the desk on physician-owned hospitals to this title. I believe it's number 22. I wouldn't swear to that, but I think it's number 22.
Amendment offered by Mr. Barton. At the end of Part 2 of Subtitle C of Title 4, add the following. Section 4315.
Mr. Chairman, I would ask unanimous consent the amendment be considered as read.
Without objection, the gentleman is recognized to explain this amendment for 2 minutes.
Mr. Chairman, very briefly, this amendment just preserves the option of our constituents who wish to go to a hospital that is owned and operated by physicians. Most of the hospitals in this country that were started in the very beginning of our nation's history were hospitals or clinics that were started and operated by physicians. For some reason, the new Democratic majority has decided to try to obliterate one of the areas of the healthcare sector that is being most innovative, most cost-effective, and most quality-conscious. So all this amendment does, Mr. Chairman, is simply reserve the right of our constituents to go to a hospital that is owned by physicians. It would allow for those people that receive Medicare to have Medicare reimbursed services that are provided by these physician-owned hospitals. It's a very good amendment, and I would ask that it be adopted.
Will the gentleman yield?
I yield to Dr. Burgess for 15 seconds.
And I thank the gentleman for yielding. This is an extremely important concept, and Mr. Chairman, with your permission, I will submit for the record an extremely insightful article that was published in Health Affairs March 24, 2008, written by a member of this committee, which detailed why this concept is so important. There is nothing like the pride of ownership, and for a physician-owned hospital or ambulatory surgery center, you want things done right because, after all, it's yours. One of the things that we have the least amount of in the practice of medicine is time, and we are able to control the time much better in an ambulatory surgery center or physician-owned hospital as opposed to an investor-owned hospital, and I won't mention any initials, but you can imagine who that might be. So I do want to submit this for the record if there's no objection, and I strongly encourage support of this amendment.
Without objection, the full statement will be made part of the record. The chair recognizes himself in opposition to the amendment. This would repeal a provision in the Children's Health Insurance Program reauthorization before it even clears both houses, and that bill closes a loophole in Medicare law that allows physicians to refer patients to themselves. The current physician self-referral law includes an exception that allows for ownership in a whole hospital but explicitly prohibits ownership in a subdivision of a hospital. And the CHIPRA, Child Health Insurance Provision, would not prohibit physician ownership, but it would simply ensure that those physicians could not refer their patients to hospitals in which they have an ownership interest. If a physician can benefit financially by referring patients to an entity in which he or she has an ownership interest, there's clearly a conflict of interest. That's why this provision that the amendment seeks to repeal was strongly supported by the American Hospital Association and the Federation of American Hospitals. The provision in CHIPRA would save $260 million over 5 and $1.24 billion over 10, reflecting CBO's and MedPAC's assessment that the incentives inherent in these ownership arrangements increase the use of health care services. So I would urge members to oppose this amendment and yield time to Mr. Pallone.
Mr. Chairman, if I could just add, I mean, the CHIP bill, which, includes this pay for, which essentially would be repealed if this went first, was passed by over a two-thirds majority in the House last week or 2 weeks ago, and it had a lot of Republican support. So, I think it doesn't make any sense to undermine what the House has already said they support, including a lot of Republicans. I yield back.
The time has expired. All those who are for this amendment, we're going to do this by a roll, not by a roll call, but a show of hands. All those for the amendment, please raise your hand. The clerk will tally. All those opposed to the amendment, please raise your hand. The clerk will report the vote.
On that vote, there were 10 ayes and 30 noes.
Yes. Well, this is not a roll call vote, but a show of hands.
31.
There are how many?
10 ayes and 30 noes.
10 ayes and 30 noes, and that might be changed here or there, but not enough to make a difference by members who would have liked to have been clearer on record. The amendment is not agreed to. That completes the amendments to this title. The question now comes on, am I wrong?
I have an amendment at the desk, Mr. Chairman.
Mr. Chairman, reserving point of order.
Yes, gentlemen.
Reserve a point of order.
Well, let's.
It's Amendment 17.
Who is offering an amendment? Let's go in order of seniority. Mr. Rogers, I think. Oh.
I have amendment number 3 at the desk.
Reserve a point of order.
Gentlelady from Colorado reserved a point of order. The clerk will report the amendment.
Amendment offered by Mr. Rogers of Michigan. In Title IV, strike Section 4410.
Without objection, the amendment will be considered as read. The gentleman is recognized for 2 minutes to explain his amendment.
Thank you, Mr. Chairman. The amendment eliminates the provision in the bill that would give states' attorney general the ability to bring a civil action as a means of enforcing the HIPAA privacy rule. The provision is unnecessary. States have the ability to incorporate HIPAA as their own state law or design different state policy law. Many states have done just that. In addition, DOJ and HHS already have the authority to pursue criminal and civil enforcement of the HIPAA rules, which has been strengthened under the bill. In fact, under current law, state AGs already have the ability to file a complaint with HHS on behalf of their residents if a potential violation comes to their attention. Worse, this bill allows state AGs to contract out this work to the private trial bar, whose interest is money, not privacy, not justice, not stimulating the economy. Furthermore, this provision makes the federal privacy law subject to local politics. State AGs are elected officials. Political by nature means that this provision will result in politically motivated lawsuits. And, Mr. Chairman, it's not just us, and I would encourage the members to take a look at the Health IT Now Coalition. It's made up of providers, consumers, several other interest groups like Michigan manufacturers, healthcare groups like Cancer and the Heart Association. And let me give you just one paragraph from that letter. We are concerned that allowing the state attorney generals to enforce the HIPAA privacy rule would lead to a patchwork of inconsistent enforcement actions that will disrupt a nationwide interoperable system and would cause great harm to promoting efficiency, cost savings, and improved care. It is quite a list, and without objection, Mr. Chairman, I would ask that the Health IT Now Coalition letter be made part of the official record. It is, the more we look at the so-called stimulus bill, the less stimulus we find. And the more onerous that we make health IT, which has the great opportunity to unleash innovation all across the United States and save lives, the more difficult we make it for that to happen, the less stimulus you get, and certainly the less safety and security you have. I would strongly encourage this body to reject the State Attorney General's ability to make it more complicated than it already will be to implement a nationwide IT health system.
Mr. Chairman, I'll withdraw my point of order.
Gentleman's time has expired. The gentlelady withdraws her point of order, her reservation for a point of order, and the chair recognizes Mr. Pallone in opposition to the amendment.
Well, Mr. Chairman, basically this provision that specifically authorizes states' attorney generals to enforce the federal privacy and security laws provides an additional layer of privacy enforcement, which I think is very important. It's an option on the state's part. It's not a requirement, but I think that if we feel, as I do, and I think most of us do, that these privacy and security provisions are important, it makes sense to have the states have that option to enforce them. I think it's particularly important, you know, given what we're doing here with HIT and expanding it and making for a lot more funding available, that there be better enforcement. And I really don't see the point of, I mean, I understand what the gentleman's trying to do, but this is just an option, so what's the harm?
Gentleman
I yield back.
yields back the balance of his time in opposition to the amendment. Mr. Barton?
I just want to put into the record a statement in support of the amendment.
Without objection, gentleman will submit a statement for the record in support of the amendment. This is a roll call. We're going to proceed to a roll call vote. The clerk will please call the roll.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingell? Mr. Markey? Mr. Markey, no. Mr. Boucher? Mr. Pallone? Mr. Pallone, no. Mr. Gordon? Mr. Gordon, no. Mr. Rush? Mr. Rush, no. Ms. Eshoo? Ms. Eshoo, no. Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green, no. Ms. DeGette? Mr. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, I'm sorry. Mr. Melanson, no. Mr. Barrow? Mr. Barrow, no. Mr. Hill? Mr. Hill, no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, no. Mr. Barton? Mr. Barton, aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal votes aye. Mr. Whitfield? Mr. Shimkus? Mr. Shattuck? Mr. Shattuck votes aye. Mr. Blunt? Mr. Blunt votes aye. Mr. Boyer? Mr. Boyer votes aye. Mr. Radonovich? Mr. Radonovich votes aye. Mr. Pitts? Mr. Pitts votes aye. Ms. Bonomack? Ms. Bonomack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy of Pennsylvania votes aye. Mr. Burgess? Mr. Burgess votes aye. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey votes aye. Mr. Scalise? Okay.
Are there members who wish to respond to the roll call?
Mr. Dingell? Mr. Dingell votes no.
Any other members wish to respond to the vote? If not, the clerk will tally the vote.
On that vote, Mr. Chairman, the ayes were 15 and the nays were 32.
15 ayes, 32 noes. The amendment is not agreed to. Mr. Blunt?
Thank you, Mr. Chairman. It's Blunt Amendment number 1. It's the one that deals with pharmacists. And I'm going to read the amendment because it's so quick. It just says, nothing under this subtitle shall prevent a pharmacist from collecting and sharing information with patients in order to reduce medication errors and improve patient safety. Mr. Chairman, new rules in this bill concerning electronic health records may actually discourage implementation of new technologies. The bill says without prior written consent, health care providers, including pharmacists, may not be able to use electronic health care medical records to engage in, quote, health care operations, end quote. This could include such activities as just simply recommending a generic drug as an alternative. Under the bill, only people who give prior consent would have access to this kind of information from a pharmacist. The public health care function that pharmacists provide to patients is critical and shouldn't be hindered. The amendment does not alter the privacy and consent provisions. It will allow pharmacists to continue to collect and share information with all patients in order to make sure they have the most accurate and up-to-date information about treatment. And again, this is very straightforward, and it just simply says that nothing shall prohibit a pharmacist from collecting and sharing information with patients in order to reduce medication errors and improve public safety, Mr. Chairman.
Gentleman, yield back the balance of his time.
I will. No, Mr.
I just briefly want to say I support the amendment.
Gentleman's time has been yielded back. The chair would recognize Mr. Pallone in opposition to the amendment.
Well, Mr. Chairman, basically what the underlying bill does is prohibit a provider from getting direct or indirect payment in exchange for using protected health information. The bill, as it stands, doesn't preclude, the pharmacists from making these communications. A pharmacist can send a refill reminder to any and all their patients without an authorization if they believe it's best for their treatment. But they can't be paid by a third party that does not necessarily have the patient's best interests at heart. And providers can request patient authorization to use their information for marketing efforts if they want to. So I think that the bottom line is we're just trying to prevent somebody from being paid by a third party when it's not in the patient's best interest. And I think that's a proper balance here to allow these communications when it's in the best interest of the patient for treatment, but not when the pharmacists or others are going to use it as a marketing tool and they're going to get paid to provide that information. So I would urge opposition to the amendment for those reasons.
Gentlemen, yield to me?
Yeah, I yield to the chairman.
Yield to Ms. Eshu.
Oh, yield to Ms. Eshu.
Thank you. I just wanted to ask Mr. Pallone, you know how much we agree with each other so much of the time and whatever. Your explanation of this, I don't think, squares away with what's in the language. I mean,
go ahead.
Ask me. How do the pharmacists? I mean, how do you leapfrog from, they're collecting and sharing information with patients to reduce medication errors and improve safety for them? How does that leapfrog into the advertising that you're talking about?
Well,
how does it morph into that?
Gentlemen, yield to me. I don't think it. I think that if the pharmacist wants to have communications with the client or patient, there's no problem with that. What the problem is if a drug company goes to the pharmacist and said, "Give me the prescription drug refill reminders that you're sending to your patients who are taking a particular drug, so that we can then send advertisements to them to take a different drug."
Right.
And so it's a third party that intervenes. If your pharmacist has information about the drugs you're taking, that shouldn't be given to anybody else. And so this doesn't interfere with, as I understand, the pharmacist-patient relationship. It precludes a third party from getting involved.
But it doesn't say that, though.
In the amendment itself?
It doesn't. I mean, it's the way I'm reading it, there's barely 4 lines here. Nothing under this subtitle shall prevent a pharmacist, doesn't say the drug companies or anybody, shall prevent a pharmacist from collecting and sharing information with patients in order to reduce medication errors and improve patient safety.
Well, you're talking,
Am I reading the same thing?
If I could
it replaces, it's instead of the provisions that prohibit the practices that we're talking about. So it doesn't say that, but it's in lieu of that.
Mr. Chairman, could we have one additional minute on each side on this?
Without objection.
I thank the Chairman. Nothing in that language allows pharmacists to share with outside parties. It just allows them to share with patients. I mean, it's very straightforward. If Mr. Plone is correct and the bill prohibits pharmacists from entering into some sort of paid relationship or relationship where they make money, that's fine. All this amendment says is that this doesn't prohibit pharmacists from communicating information with patients. It doesn't address communicating information with drug companies. Maybe they are prohibited from some sort of third-party pay, but this, unless the patient was third-party paying them, this shouldn't prohibit that, and I'd yield to Chairman. I'd yield to Chairman Barton.
Along with Mr. Markey, I'm one of the strongest patient advocate privacy rights in this Congress. I support this amendment. This does not deal with marketing to outside. It says sharing information with the patient. That is a good thing, not a bad thing. We should support this.
Mr. Pallone has 1 minute.
Well, my concern, if this language in the amendment is added, is that it could be interpreted to say that you can share this information even if you are getting paid, and you don't need the authorization from the patient. In other words, it would directly repeal and say, okay, if the third party now decides that they want to share this information and pay me, I can do it without the prior authorization of the patient. And I don't really understand what you'd be getting at unless that was the purpose of this amendment. That seems to be the purpose of it.
Gentleman still has.
My concern, Mr. Chairman, if you will, is that this directly undermines and would say that the pharmacist could now get paid and share this information without the prior authorization of the patient, and it therefore would directly repeal what we have in the underlying bill. That's how I would read this amendment.
Ms. Pallone,
Let me. It seems like some confusion, and maybe we're arguing about something legitimate, maybe we're not. Would you just pull it back, and we'll come back to it by unanimous consent, even if we've gone to another title?
Yes.
Okay. Without objection, the amendment is withdrawn without prejudice. Further amendments. Mr. Rogers.
An amendment at the desk, Mr. Chairman. I believe it's listed as Rogers Amendment 1. 1.
Amendment offered by Mr. Roger.
Without
Roger
objection,
Ferguson.
the reading of the amendment will be dispensed with, and the gentleman.
Mr. Chairman, I reserve point of order. Point of order against amendment.
Point of order is reserved against the amendment by the gentleman from Michigan. Mr. Rogers, recognized for 2 minutes.
Thank you, Mr. Chairman. And this is along the same vein as the Blunt amendment, and I would hope that we would all view this as a technical change, and if you were willing to work with us in some compromise to get it in the larger bill, I'd be willing to do that. And really what happened, I think, in our rush here is that this provision would require a pharmacy to receive prior authorization before sending refill reminders to a patient. And I think in our rush to do something good, we may have overstepped a little bit. And I think pharmacies and providers took a look at this language and said, "Whoa, you're not allowing us to do something that will have a direct impact on patient health." Non-adherence with medications is a significant problem in the United States. 3 out of 4 Americans report not always taking their prescription medication as directed. This would prohibit them from contacting those patients and trying to remind them, how you're doing with your medicine, you need to keep taking your medicine. Pharmacies should be allowed to communicate with patients regarding their prescriptions and treatment plans. So, Mr. Chairman, I don't want to go on and make a big deal of this. I do think that it's a big deal to pharmacies, it's a big deal to providers, and I would hope that we could work something out on this, even in the amendment. And I do know that there is significant support of that on both sides of the aisle. So, at your discretion, Mr. Chairman, I'll take direction from you on how you'd like to do that. But I do believe that there's something that we can compromise on here. Yeah.
Mr. Chairman, I withdraw my point of order against the amendment. It is germane.
Point of order has been withdrawn. And Mr. Pallone. If the gentleman would permit, why don't we pull this one back?
Yes, sir. And
consider it together with the other one and see if there's a dispute or not, or if we can resolve it.
Great, Mr. Chairman, I'll do that.
Without objection, that amendment will be withdrawn without prejudice. Further, Mr. Markey?
I have an amendment at the desk, Mr. Chairman.
Mr. Markey has an amendment at the desk. Without objection, that amendment will be considered as read, and the gentleman is recognized to explain his amendment.
I thank the Chairman very much. My amendment would add an additional security requirement that I believe is important to safeguard consumers' personal health information. My amendment would simply mandate the protection of patients' medical information when it's transmitted through the health IT infrastructure created under the bill, or when it's removed from these health IT systems and put on mobile devices such as laptops.
Mr. Markey, will you yield? As I understand it, your amendment has been reviewed by both the majority and the minority staff.
That's correct.
And I know that we're prepared to accept it.
I thank the gentleman.
Mr. Markey, I too, on the minority side, am prepared to accept it. I would ask that you consider, as you move this to the floor, putting some language in that gives some flexibility as standards change, give entities the ability to use a standard that is equal to or better than the standard in existence, so that we don't lock something in. I mean, there's some concern that this language may be too rigid, that it...
If the gentleman would yield to me, my intention is that it not mandate a particular technology be used to make the data unreadable, only that the technology does accomplish that goal. So to the extent to which something which is equal to or better than that standard or something
we
that
support the amendment if you would let some of the staff work in some flexibility.
I have no problem with that. I thank the gentleman.
Is there any objection to the Markey amendment? Then by unanimous consent, it's agreed to.
Thank you.
Further amendments? Mr. Murphy from Pennsylvania.
Thank you, Mr. Chairman. I have an amendment at the desk, 001.
Without objection, the amendment will be considered as read and distributed. And the gentleman is recognized for 2 minutes.
Thank you, Mr. Chairman. So many of us have been supportive of health information technology when we recognize that it saves lives and saves money. One of the things we have to understand is that this bill is supposed to be about helping our economy and creating jobs. A lot of the technology work and the software support is done in this country, but very often is also farmed out to other countries. So you may have a hospital in the United States working on their health information technology, and much of the work may be done in other nations. Fine people in those other nations, but when we're spending $20 billion on this, our goal is to create American jobs. This amendment is a Buy American clause. It does not affect companies that are owned foreign, but just the work that is done in the United States. And I urge my colleagues to support this, recognizing also that very often when any of us contact companies, perhaps we have software issues or problems with our computers or credit card issues, we find ourselves frequently talking to folks across the globe as opposed to in other parts of the United States.
Will the gentleman yield?
Yes, Mr. Chairman, I will.
We're prepared to accept your amendment.
Thank you, Mr. Chairman. With that, I yield back my time then.
Any further discussion? Are we ready for the vote? All those in favor of the Murphy amendment say aye. Aye. Opposed, no. The ayes have it, and the amendment's agreed to. Are there further amendments?
Mr. Chairman.
Somebody on this side? Yes, Ms. Christensen.
Thank you. Mr. Chairman, I have an amendment at the desk. I believe it's number 2. The amendment I'm offering simply ensures that...
Without objection, the amendment will be considered as read, and the gentlelady is recognized to explain her amendment.
Thank you. It ensures that the great promise of HIT and efforts to save valuable health care dollars, reduce medical errors, and advance patient-centered medical care also includes reducing health inequities by inserting reducing health disparities in Section 3001, page 8, line 14. These inequities not only cost the health care system, but also leave millions of otherwise hardworking Americans in poorer health and more likely to be sick and die prematurely during what should be their most productive years. The amendment also ensures that as the HIT Policy Committee makes recommendations about bolstering patient privacy, strengthening the HIT infrastructure, and expanding HIT implementation, use, and coordination, that they also make recommendations about utilizing HIT to reduce health disparities, and that's by reducing health disparities on page 21, line 4 of section 3002. And the research on health disparities is overwhelming by the Institute of Medicine, Department of Health and Human Services, and many reputable think tanks. And we have this opportunity to not only modernize our healthcare system, but to also ensure that health equity is a component of this new system, and we cannot pass up that opportunity. I want to thank you, Chairman Waxman, for allowing me to offer this amendment, and I urge my colleagues to support it.
If the gentlelady will yield to me, I would urge that members adopt this amendment. Both the majority and the minority staffs have reviewed it. I want to commend you on this amendment. I think it's a very important one, and would urge all members to accept it. If there's no further discussion, all those in favor of the Christensen amendment say aye. Aye. Opposed, no. The ayes have it, and the amendment's agreed to. Further amendments. Mr. Bergner.
Thank you, Mr. Chairman. Amendment 0017.
Mr. Chairman, reserving the right to, reserving point of order.
Gentlelady reserves a point of order. Without objection, the amendment will be considered as read. The gentleman is recognized for 2 minutes to explain this amendment.
And I thank the Chairman. This amendment would create an exemption to stark anti-kickback laws that currently prevent hospitals and other groups from sharing technology with physicians. Hospitals and doctors' practices are prohibited from contracting with one another for the purposes of technology or software transfer. While recent Health and Human Service regulations allow hospitals to donate equipment to doctors' offices, they're still prohibited from entering into long-term contractual relationships to develop the purposes of maintaining, upgrading equipment and software over time. And any physician's office who's ever gone to electronic medical records will tell you it's not just the cost of the equipment up front, but it's also the cost of training personnel and the cost of maintaining the software over time that is adds to the expense. Providing a narrow exception under the federal antitrust law for the ability of healthcare providers to work off of similar technological platforms makes sound business sense and will improve the adoption of health information technology. Mr. Chairman, recently I attended the Commonwealth Fund symposium that they have every year. We heard from a large medical practice in western Pennsylvania, and they would like very much to be able to put technology in all of their doctors' offices, but they're prohibited from doing so under the STAR clause. As a consequence, they've gone to a web-based portal, but then they get into difficulty with the privacy aspects. So we've really constrained the private sector from moving ahead with technology that we've told them to develop. Coordination in healthcare, we all talk about it, and we say it leads to better health outcomes. And if we're focusing on how greater information technology deployment can revolutionize...
Mr. Chairman, I hate to interrupt my Texas colleague, but could we get a copy of the amendment?
Let's be sure we have the amendment distributed.
Thank you, Mike. I just wanted to read it.
The gentleman, I think, had 20 seconds if you wanted to complete your statement.
Well, I just simply conclude by saying we talk about revolutionizing the practice of medicine with information technology. We should eliminate the legal barriers to greater coordination of care. This is going to be critical. This amendment provides for a narrow exception under a law, and it is cost-free. As we pour money into this sector of the economy, I mean, it is literally raining money today. Our dollar will go so much further if medical practices, hospitals, and clinics can jointly share in the cost of capital of these systems. Now I'll yield back the balance of my time.
Gentleman's time has expired. As I understand it, when Mr. Burgess had an amendment before, the wrong amendment was passed out, and that's this amendment. So we will try to make copies available for members who wish to have copies of this amendment. And
Anything I can do to help the cause?
And Mr. Burgess has offered his personal copy, and he's willing to autograph it. In the meantime, Mr. Pallone, do you seek recognition in opposition to the
Mr. Chairman,
amendment?
I withdraw my reservation.
Gentlelady withdraws her reservation for a point of order.
Mr. Chairman, if you remember, those of us who've been here a few years, when there was in the Republican majority Congress a few years ago an effort to move an HIT bill through this committee, and the source of funding was basically to loosen the Stark and anti-kickback and anti-fraud protections. I don't believe that that's an effective means of paying or actually producing a good HIT bill. I mean, what we're doing today, and I think it's very significant in the underlying bill, is we're funding HIT through Medicare and Medicaid, and we're actually providing the money up front to do this. We have direct funding for health IT, not these fraud loopholes that essentially have been talked about in the past. And my fear is that you're just, that this is not the proper way to go about it. I think it's important to continue those Stark and anti-kickback and anti-fraud protections, not use them as a way of paying for the bill, particularly now that we have the opportunity with this economic stimulus package to actually pay directly to proceed forward with these great provisions. So I would urge our members to oppose this amendment. Again, it goes back to what the Republican majority was trying to do before, and I think it's not the proper way to proceed when you're trying to really effectively do a good HIT program.
Well, gentlemen,
I would yield to Mr. Waxman, the chairman.
The underlying bill provides billions of dollars to doctors, hospitals, and others to incentivize the adoption of an electronic health record. An electronic health record allows providers to communicate with each other, even with providers across the country. CMS and OIG promulgated appropriately tailored exceptions to the Stark anti-kickback laws in 2006. Now, these exemptions permit the donation of health information technology as long as that technology permits electronic communication among recipients. The amendment emphasizes loosening Stark anti-kickback, anti-fraud protections. And these exemptions, I think, undermine the connectivity this bill aims to achieve. So I would urge my colleagues to oppose this amendment. Are we ready?
Mr. Chairman?
Yes.
I realize I've used all my time, but
Gentleman's recognized for 30 additional seconds.
well, first off, this bill before us today, no money comes to anyone before 2011, so that's a big problem. There's not a lot of immediacy to this bill. And honestly, this costs nothing, and it's not a question of, it's a question of being able to leverage. We all admit it's raining money right now. There's no stop to the amount of dollars that are being pumped forward. Why not leverage those dollars so they're spent more efficiently? One of the things we could do is define privacy once and for all and not change our minds every 30 minutes. Mr. Rogers tried that. You knocked it down. The other thing we could do is relax some of the regulatory framework. These are 30-year-old laws that have no place in the 21st century.
Gentleman's time has expired. I will elaborate further on that we are spending $2 billion right away under this bill. We'll now proceed to a vote. How does the gentleman wish to have this vote taken? You want a roll call? Okay, the clerk will call the roll.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingell? No. Mr. Dingell, no. Mr. Markey? No. Mr. Markey, no. Mr. Boucher? Mr. Pallone? No. Mr. Pallone, no. Mr. Gordon? No. Mr. Gordon, no. Mr. Rush? No. Mr. Rush, no. Ms. Eshoo? Ms. Eshoo, no. Mr. Stupak? No. Mr. Stupak, no. Mr. Engel? Mr. Green? No. Mr. Green, no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Barrow, no. Mr. Hill? Mr. Hill, no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, no. Mr. Barton? Mr. Barton, aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Stearns? Mr. Stearns, aye. Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Shimkus? Mr. Shadegg? Mr. Shadegg, aye. Mr. Blunt? Mr. Blunt, aye. Mr. Boyer? Mr. Boyer, aye. Mr. Radonovich? Mr. Radonovich, aye. Mr. Pitts? Mr. Pitts, aye. Ms. Bono Mack? Ms. Bono Mack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy, Pennsylvania, aye. Mr. Burgess? Mr. Burgess, aye. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Mr. Engel? Mr. Engel votes no.
Any other members wish to be recorded?
Mr. Sarbanes. Mr. Sarbanes votes no.
Have all members responded to the vote? The clerk will tally the vote.
On that vote, Mr. Chairman, the ayes were 16, the nays were 32.
16 yeas, 32 noes. The amendment is not agreed to. Further amendments? Mr. Rogers.
Thank you, Mr. Chairman. This is something I hope we can agree to as well. In the last rendition of HIT, we agreed with the chairman. I withdrew this amendment, because we agreed that there was some common ground on this and we could work it out. Unfortunately, we didn't have the opportunity to do that. The bill never moved forward. But what this does, it's about the accounting of disclosures. And under HIPAA, individuals are currently entitled to an accounting of certain non-routine disclosures of their protected health information. That's a good thing. Providers are required to compile a list of these disclosures at the patient's request, also a good thing. However, there is an important exception for treatment, payment, and healthcare operations function. Unfortunately, this bill, I hope inadvertently, removes that exception. Providers conduct millions of legitimate, justifiable disclosures each year for the purposes of treatment and payment. You have to do it. I mean, there's no other way the system works. And if you can imagine, as an example, if a doctor is looking for a second opinion, he sends an email, according to this new law, he'd have to find a way, or she would have to find a way to account for that email for 3 years. I mean, it is very onerous, and it's really not protecting the patient to the degree I think we all agree should happen, but it does add this an onerous regime on these providers to do something that I think we can all agree should protect them, maybe not in this way. The information, by the way, is rarely, if ever, requested. I'll give you an example. One of the largest pharmacies benefit managers, a PBM, covering 60 million patients, has only received 6 of these very specific requests over 10 years. 60 million patients, 6 requests over 10 years, and we're going to create this whole regime of them having to require every disclosure when somebody opts out and says, this is how much money you owe, they have to now account for that as a disclosure. I really think that if we go where we're trying to protect the patient, this doesn't help. Actually, it's going to add lots of costs, lots of confusion, and it's quite clear it does not benefit the patient given the number of requests they've received. So, Mr. Chairman, as I said, the last chairman said that we would work this out. I would, at your desires here, I will withdraw. If you want to work this out, I'd be happy to do that. I think we'd find lots of common ground on this amendment. Or you could accept it. That would be good, too.
If the gentleman will yield to me, I think the amendment makes it more complex, and I don't quite see a way to work it out.
Oh.
I'm sorry to tell you that. So we're going to have to oppose the amendment. I want to recognize Mr. Pallone.
Mr. Chairman, I think that actually the gentleman's amendment would make it more difficult to separate out when a disclosure is made for treatment purposes versus payment purposes versus health care operations. Basically, it's going to require more work for providers to separate out the disclosure for these different purposes. Obviously, transparency is very important if you want to ensure the privacy and security of the individual's health information. And all this underlying bill does is require that the entities maintain an audit trail of when a patient's information was disclosed, and that could be for treatment, payment, or health care operations. I don't see I think it would just be a lot more difficult and allow for less transparency if you basically said that we're not going to do this for treatment or payment purposes and only for the healthcare operations category. So I don't see, again, I agree with the chairman that there's really no way to work it out because we want to provide this transparency for all these purposes.
Would the gentleman yield just for the time you have left? What you're talking about, though, doesn't exist today. They have to do the audit trail on other than treatment and payment disclosures. But now what you're telling them to do is every time you provide that treatment and payment, you have to cut an audit trail for every one of those so-called disclosures. That happens millions of times every single day in the administration of our healthcare system. And that's why pharmacists disagree with you, providers disagree with you, insurers disagree with you, that that they look at this and say, geez, this is a huge, huge ask, very expensive, for no gain to the patient. So I would argue it really keeps in place what is a good audit trail today, and they should have to disclose or audit those disclosures, except when it comes from the ordinary routine business of providing health care in America. You've created a whole new standard. It's not my time
yield
to
to the chairman.
Well, I just want to make the point that the bill has been modified since it went through the committee when this was first offered, and entities maintain an audit trail of a patient's information through an electronic health record, including for treatment, payment, or health care operations such as quality assessment and medical review. And has changed the bill only applies to disclosures from the electronic health record and only requires data that can be automated be collected about those disclosures. So I would join you in opposition.
Again, now they'll have to track emails, Mr. Chairman. I hope we know what we're doing to these folks. It's going to be fairly onerous. But with that, I'd request a roll call vote.
The amendment is before us. All those in favor of the amendment say aye. Aye. Opposed, no. No. The amendment's not agreed to.
How about a show of hands?
Well, the gentleman requested a roll call vote. I thought we had some understanding as to when we're going to have roll call votes and when we're not. All those who want to...
In the spirit of cooperation, Mr. Chairman, I'll withdraw that. However, we were also to understand that you would work with us on some of these amendments.
Well, I'm always
certainly very willing and eager to do that.
I'm always available to work with you.
Well, I will withdraw that, Chairman, but I think this is something we absolutely have to come to a conclusion in. And everybody in the community disagrees with your assessment of what it will ask them to do versus the benefit of the patient. So I'll withdraw my request for a roll call vote under the condition that you'll work with us, Mr. Chairman.
I certainly will promise to work with you further on it. Further amendments? Mr. Burgess?
Mr. Chairman, Burgess Amendment 001.
Let's be sure we get the right amendment.
Sure. I'll wait. I'm clearly in no hurry.
Mr. Chairman?
Gentlelady from Colorado, reserve a point of order?
Yes, sir.
Point of order has been reserved.
Amendment offered by Mr. Burgess of Texas. Add at the end of the section 18480 of the Social Security added by section 4311A of Title IV, the following, quote, 6, additional limitation, notwithstanding the previous
Without objection, the reading of the amendment will be dispensed with, and the gentleman is recognized for 2 minutes.
And I thank the Chairman. This amendment is all about priorities. We've agreed that we need to lay a rapid groundwork for rapid deployment of information technology in health care. Medicare is near the breaking point. But the bill we have before us today has missed an opportunity to shore up Medicare. And again, we're talking about stabilizing provider payment rates. We all hear about new Medicare beneficiaries finding it difficult to locate a doctor that will take Medicare. When seniors relocate, it can be a struggle for them to find a doctor who's even willing to see them. This is all because physicians around the country are starting to realize that Medicare is an unstable payer, subject to the whims of political will and influence, and they're doing what they have to do to protect their small businesses. We've talked about it before. The sustainable growth rate formula is the mechanism that cuts Medicare payments on nearly an annual basis, and it's flawed and it must be eliminated. I know this isn't an easy task or one that we can do quickly, but I think Congress can fix this problem, and if we don't, we'll see Medicare access problems fester and physicians will flee the program in droves. It isn't good for seniors, it isn't good for the country, and ultimately it's not good for the Congress because these are your constituents who will be upset. This amendment merely states that should the sustainable growth rate formula still control Medicare payments by 2011, the Secretary may not make any Medicare health information technology incentive payments authorized under the bill. So it's an incentive for us to get busy and get the SGR repealed. A vote against this amendment will be a vote in favor of the status quo. A vote for this amendment will give Medicare patients and physicians the hope that change is indeed right around the corner. I'll yield back.
Mr. Chairman, I withdraw my reservation.
The gentlelady withdraws her reservations. This amendment is similar to other amendments. It's just another way of phrasing it to require that we update the physician fee schedule. And if we don't, then doctors won't get their bonuses on health IT. I think that's just doesn't make a lot of sense to say the doctors can't participate and get bonuses in it for doing what we'd hope they do on health technology, unless we give doctors an upgrade in their physician fee reimbursements, which we hope to do at some later time. So I would urge opposition to this amendment.
Well, the gentleman yield for one additional point. I would just state that under the health...
I must have a soft spot for you. I yield.
Well, the e-prescribing bill that was passed by the Democrats in the House in July has a penalty that goes into effect in 2012 if doctors aren't using e-prescribing. We're fixing to give with one hand and take away with the other. All this amendment does is say we are committed to fixing this, and we're so serious about it, we're going to put a backstop where we will not go past 2011 before this SGR problem is fixed.
Well, I understand what you're trying to do. I just don't think we ought to do it in this bill, and we ought to solve the underlying problem that you raise, which is a legitimate one on physician fees, but not here, not now, not us, not now.
If the gentleman will yield, it is raining money right now, and this is the time to seize the day, carpe diem, and fix the problem.
The gentleman raises a good point in Latin. Are we ready for the vote? All those in favor of the Burgess Amendment will say aye. Aye. Opposed, no. No. The noes have it. The amendment's not agreed to. Further amendments to this title? Yes. Gentleman from Georgia.
Thank you, Mr. Chairman. Mr. Chairman, I actually have two amendments, and the first one I'm sure that you're going to rule non-germane, and I'd like to discuss it briefly, and then I'll withdraw it.
But, Mr. Chairman, I'll reserve a point of order.
Clerk should appoint the non-germane amendment first.
Mr. Chairman, I thank you. I think my colleagues on...
Oh, wait a second. Let's follow the procedure of getting the amendment before us.
Sure.
Do we have the number, please?
I think it's number 1, Gingrey number 1. Correct.
Yeah. Amendment to the committee print offered by Mr. Gingrey of Georgia.
Without objection, the amendment will be considered as read. The gentlelady for Colorado reserves a point of order, which it appears she may assert. Gentleman from Georgia, Mr. Gingrey, is recognized for 2 minutes.
Mr. Chairman, I thank you, and I do intend to withdraw the amendment. I think my colleagues on the other side of the aisle know that I have worked very closely with some of them on HIT, electronic medical records, in particular Mr. Gonzalez from the Small Business Committee, with Chairman Gordon on the Science Committee. And I think, quite honestly, the HIT legislation in the bill is some of the best. But I don't think that there's enough incentive in regard to the grants and everything that's provided to some doctors and some hospitals. There are going to be far, far too many that just simply can't afford the sticker shock of electronic medical records. So this amendment would allow them to expand, would allow us to expand Section 179 of the IRS code so that a group of physicians could take up to $250,000 deduction in the year that they purchase the hardware, software, instructional, whatever package for electronic medical records. And it will expand the amount of money they could write off in a 5-year window to according amount. But again, I think the Ways and Means Committee will probably take up this. I hope that Chairman Stark and Ranking Member Herger will look at it as well. But this basically would say allow physician groups up to $250,000 of a tax deduction in the year that they make the purchase. An individual obviously would not spend that much money, but whatever they spend, $30,000 or whatever, because they may very well not be in line to get those grants that some of the lucky ones will get. So with that, I just want to make sure that all my colleagues understand what I'm trying to do. I think it's a worthy thing. I think that there are way, way too many physicians that are not going to buy into this because they just can't afford it. And with that, Mr. Chairman, I'll withdraw that amendment.
Gentleman withdraws his amendment. Gentleman wish to be recognized on his second amendment?
I do, Mr. Chairman.
There's a another Gingrey amendment at the desk? We'd like to have-
Chairman,
Yes.
I'll reserve a point of order.
Gentlelady from Colorado reserves a point of order.
Amendment offered by Mr. Gingrey of Georgia in Section 184801B3 of the Social Security Act, 42 U.S.C. 1395W through 4, as added by Section 4311 of Title 4.
Without objection, the
Strike.
gentleman's amendment will be considered as read, and he's recognized for 2 minutes.
Mr. Chairman, I thank you. And this second amendment dovetails into the first one, although I hope the gentlelady from Colorado will withdraw her point of order. I do think this is germane. Basically, in this bill, we have both carrot and stick to punish those who don't get on board with electronic medical records and incentivize those that do. But quite honestly, Mr. Chairman and my colleagues, I don't think that the incentive is enough, and I think the punishment is too much. The stick is too much. This amendment would simply say, instead of giving them an incentive payment for electronic medical records in 2011 that would last 5 years and then sunset, we would accelerate that to 2010. Those who adopt fully integrated electronic medical records would get that incentive payment in 2010, and it would last, it would not expire in 2015 automatically. It would only expire when there's 85% saturation, or 2018 as a drop-dead date inside the 10-year budget window. On the stick side, those who would, in 2015, would start being penalized for not adopting electronic medical records. What we would say is that penalty would not occur until at least 50% adoption had occurred. And then it would only last until 2018, again within the 10-year budget window. I know it sounds a little complex, but quite honestly, what I'm trying to do with this amendment, Mr. Chairman, colleagues, is to further incentivize, because clearly we want, I believe the RAND study of a savings of $160 billion a year for full adoption and integration. I believe that. So I want to incentivize. I see my colleague from the chairman of the subcommittee would like for me to yield. I'd be glad to yield to Mr.
Well, the gentleman's time has expired.
Chairman, I withdraw my reservation.
The gentlelady withdraws her reservation for a point of order. Mr. Pallone, do you seek recognition?
Yes, Mr. Chairman. My concern is that the standards and the plans that we're trying to put into effect would not be eligible to be certified, and we wouldn't know whether they're deserving, essentially, of a bonus payment by 2010. In other words, this was set up with the year 2011 because that's how long it was assumed in a rational way it would take to be able to get the standards in place and have those plans ready to be certified and therefore deserving of the bonus payment. So that's why I would oppose.
The gentleman would yield on his point of order.
Gentlemen, well, there's no point of order. That's been withdrawn. Gentlemen, yield to me.
Yes.
I also would oppose this because while it advances the bonus payments, we don't know what that's going to cost. And without knowing what the cost will be, we don't know how that affects the overall amounts in this bill and the balance in the legislation. And so for that reason, in addition, I would urge opposition to the amendment. Do you yield back the balance of your time? All time has expired on the amendment. All those in favor of the amendment say aye.
Aye.
Those opposed say no. No. The noes have it, and the amendment's not agreed to.
Mr. Chairman?
Yes.
We have no more amendments to this title. We are still working on language modification. You have one more? Well, all right.
Mr. Burgess?
I thought we were through.
Burgess 003.
Mr. Chairman?
Gentlelady reserves a point of order. The clerk will report the amendment and we'll have it distributed.
Amendment offered by Mr. Burgess of Texas. In Title 4, add at the end of Part 2 of Subtitle C the following. Section 4315, Accelerated Incentives. Section notwithstanding any other provision of this part or any amendment made by this part, the Secretary shall establish a method under which any incentives payments established pursuant to the amendment made by Section 4311 or 4312 shall be available to an eligible professional or eligible hospital, respectively, beginning in June 2009.
Gentlemen, the amendment is before us. Gentleman is recognized for 2 minutes.
Thank you, Mr. Chairman. I'll be very, very brief. But this bill, the stimulus bill that's before us, is to stimulate the economy through a massive infusion of federal dollars, the likes of which we've never seen before, into the United States economy. But the provisions related to health information technology, incentive payments to providers and hospitals, don't go into effect until 2011. So most economic projections I've read or seen have the recession that we're in now will likely be concluded by that time. If we are to accelerate the payments available to providers and hospitals, this new program would be more stimulative in nature, and these dollars will be available much earlier than 2011. By making an early and substantial investment in health information technology, we can help kickstart the economy sooner rather than later, which should be the intent of the legislation we have before us today. Now, Ms. Eshoo noted in her opening statement that we can't fiddle while Rome burns. She said this is as urgent as it comes. Well, since it is an economic stimulus bill, it would make more sense if the payments in this bill went out now as opposed to 2011. My amendment would make the Medicare HIT incentives created in this bill available in June 2009 as opposed to beginning 2 years later, and I'll yield back the balance of my time.
Gentleman yields back the balance of his time. Mr. Gordon, recognized for 2 minutes.
Yeah. Well, I'm, first of all, very pleased that this afternoon and tonight we've established that health IT is important and that it's going to save lives and money. I think that's the good news. With another analogy, Dr. Burgess, we also don't want to put the horse in front of the cart. You might remember back in 2002, this Congress appropriated hundreds of millions of dollars for the states to purchase electronic voting systems before the complete technical system of standards were set up and conformance tests were put in place. And now you're seeing them scrap those. To give you a more local analogy, George Washington University just built a new hospital. They have a health IT system in the emergency room, and they have one in the regular hospital. They can't communicate. And so the reason that there was we do not want to waste money by allowing people to start buying systems before the technical standards are established, and also that the test beds are put together so that that software can be given, for lack of a better term, the good housekeeping seal of approval. We want to get it out the door as quickly as possible. There's money in this bill that helps to accelerate that process to get those standards. And I would, again, I agree with your premise, or whether with your good intentions, but I'm afraid that it doesn't work in this case.
Will the gentleman yield for just one additional?
For whatever time I have, or for a portion of whatever time I have.
I appreciate that. And, of course, you demonstrate so clearly why health information technology does not belong in a stimulus bill. And I will be happy to stipulate that point. That's a point I've made.
Well, first of all, I'll reclaim my time. There are billions of dollars that are being spent up front. There's also, by doing this, it sets certainty in the private sector for them to go ahead and start hiring people, getting ready for this. And so it is, money doesn't have to be spent to stimulate the private sector when they know that it's going to be coming. We want to do this. We want to do it right. I can't imagine that you would want doctors to be spending money on systems that may not qualify later.
Gentleman's time has expired. All time has expired. All those in favor of the amendment say aye.
Aye.
Opposed, no. No. The noes have it. The amendment's not agreed to. As I understand, this is the last amendment, but we had earlier considered some amendments that we put aside temporarily, and I would ask unanimous consent that we be able to return to those amendments at a future time.
We agree with that, Mr. Chairman.
Then the vote now comes on the amendment in the nature of a substitute as amended. All those in favor of the...
Point of inquiry, Mr. Chairman?
Yes.
The amendments that we withdrew in order to work with the staff have been disposed of?
We'll come back to them.
Okay.
All those in favor of the amendment in the nature of a substitute as amended say aye. Aye. Opposed, no. The ayes have it. The amendment's agreed to. Now the vote comes on reporting the committee print as amended. All those in favor say aye. Aye. Opposed, no. The ayes appear to have it. The ayes have it, and the motion's agreed to. We will now move to the next committee print, which is the chair calls up the committee print regarding health insurance assistance for the unemployed. Without objection, the committee print will be considered as read. The clerk will designate Section 1 to open up the amendment process.
Title 3, Health Insurance Assistance for the Unemployed. Section 3001, short title and table of contents of the title.
The chair has an amendment at the desk in the nature of a substitute, and without objection, the amendment will be considered as read and as base text for the purpose of amendment. This amendment contains minor changes to the text, consolidates two Medicaid eligibility categories, individuals who are receiving unemployment benefits and individuals who have exhausted those benefits, into one optional category. It also makes conforming technical changes. The majority and minority staff have been provided with the text. I have further statements in my comments, which I would like to make part of the record in explaining this amendment in the nature of a substitute. The chair will now call for amendments to the amendment in the nature of a substitute.
Mr. Chairman.
Mr. Barton.
I have an amendment number 34 at the desk.
Mr. Chairman.
Gentlelady from Colorado reserves a point of order. Gentleman is offering an amendment which is at the desk. The clerk will report the amendment, and we would ask that it be distributed.
Amendment offered by Mr. Barton. In Section 3002A3.
Without objection, the amendment will be considered as read. The gentleman from Texas is recognized for 2 minutes in support of his amendment.
Mr. Chairman, I'll try to give you back some of that time. The base text that's before us has a new program that allows the federal government and the taxpayers that fund the federal government to pay the COBRA premiums for people who have lost their jobs. That is a noble idea. However, it puts no means test on it. For example, an executive with Lehman Brothers who's making millions of dollars a year and has millions of dollars in personal assets lost their job. Under the base text, they are eligible for COBRA premium assistance under this bill. I don't think that's right. So I'm offering the Lehman Brothers amendment to the bill that simply says if you have an annual income of over $100,000 and assets of over $1 million, you don't receive the COBRA premium assistance subsidy in the base text of the bill. It's that simple.
Gentleman, yield back the balance of his time.
I don't see anybody that wants to talk on my time, so I do.
And Mr. Pallone, are you prepared to speak on this amendment?
Well, Mr. Chairman, I mean,
the gentleman is recognized for 2 minutes.
You know, my concern with all this is that, you know, right now, because of the situation that we face, you know, where people lose their job at any given time in the year, you know, may find their circumstances change dramatically, you know, you might be making, I don't know, what did the gentleman say, $100,000 last year, but then all of a sudden you're in, you know, January of this year and you've lost your job and you have no money. So I just think that when we start getting into these, you know, these caps or means or assets tests, it really isn't appropriate given the fact that some people find themselves in a situation where they have lost their job and they may not be any different than anybody else at that point in time. So, this is temporary. I understand what the gentleman is trying to achieve, but I am concerned that once you start going down this road, we are going to start eliminating people who may actually need the help. And I haven't, I'm looking at the actual amendment here, and I would be concerned that we might find people in that category.
Gentleman yield?
Yeah.
I think there's some strong arguments to make for a means test, but I can't see how we would set up such a means test. We'd have to take somebody who just lost their job, that's what makes them eligible for COBRA, and then try to figure out what their income is. If you go backwards, their income might have been pretty good, but if you go to that moment, their income may not be all that good since they lost their jobs. And then you'd have to set up an assets test, and I don't know how you do that for a program that's only going to run for 2 years. So I would join you in opposing the amendment.
Would the gentleman yield?
Chairman, I'll withdraw my reservation.
Gentlelady withdraws her amendment.
Last 4 seconds.
Mr. Barton.
Let me simply say that some of these temporary programs sometimes become permanent programs. It took us 100 years to repeal the temporary surtax on telephone service for the Spanish-American War. So I would be leery of calling some of these programs temporary.
Well, I don't think anybody intends this to be a permanent program. All time has expired on the amendment. We're going to proceed at the request of Mr. Barton to a roll call vote, and we'd like the clerk to call the roll.
Mr. Waxman? No. Mr. Waxman? No. Mr. Dingell? No. Mr. Dingell? No. Mr. Markey? Mr. Boucher? Mr. Pallone? Mr. Pallone? No. Mr. Gordon? Mr. Rush? Ms. Eshoo? Ms. Eshoo? No. Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Green? Mr. Green, no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Barrow? Mr. Barrow, no. Mr. Hill? Mr. Hill, no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Barton? Mr. Barton, aye. Mr. Hall? Mr. Hall votes aye. Mr. Upton? Mr. Stearns? Mr. Stearns votes aye. Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Shimkus? Mr. Shattuck? Mr. Shattuck, aye. Mr. Blunt? Mr. Blunt, aye. Mr. Boyer. Mr. Boyer votes aye. Mr. Radonovich. Mr. Radonovich, aye. Mr. Pitts. Mr. Pitts, aye. Ms. Bono Mack. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mr. Sullivan. Mr. Murphy of Pennsylvania. Mr. Murphy, Pennsylvania, aye. Mr. Burgess. Mr. Burgess votes aye. Ms. Blackburn. Mr. Gingrey. Mr. Gingrey votes aye. Mr. Scalise. Mr. Scalise. Okay. Mr. Rush. I'm sorry. Mr. Rush votes no. Mr. Gordon. Mr. Gordon votes no. Mr. Engel. Mr. Engel votes no.
Have all members responded to the vote? Mr. Markey, have you voted?
Mr. Markey votes no.
Any other member wish to respond to the vote? If not, the clerk will tally the vote.
On that vote, Mr. Chairman, there were 14 ayes and 30 noes.
14 ayes and 30 noes. The amendment is not agreed to. Further amendments?
Mr. Chairman.
Mr. Stearns.
I call up amendment number 33.
Mr. Chairman, reserving point of order.
Gentlelady from Colorado reserves a point of order.
Could you repeat the number, please? I'm sorry.
33.
33.
It was the Barton amendment, but now it's the Stearns amendment.
And it was 25, but now it's 33.
It's the same amendment with no income test.
Amendment offered by Mr. Barton. In Section 3, oh, I'm sorry, it's for Mr. Stearns. I apologize. It's late.
Without objection, the amendment will be considered as read. The gentleman from Florida is recognized for 2 minutes.
You know, this amendment is not necessarily the Barton amendment or the Stearns amendment. It could be the Bernie Madoff amendment, because what we have here is we're asking that people that make more than $1 million, it would prevent them, in fact, if they had $100 million, it would prevent them from receiving COBRA premium assistance subsidy. So, you know, when you look at what we had in the previous amendment, it might have been called the Lehman Brothers amendment, but I think this one is a Bernie Madoff amendment, because all I'm asking is if you have an income over $1 million, and this means, you know, you could have 50 million, 100 million, that, you know, the government should not step in and start to pay your health insurance. Taxpayers have to pay 65% of the COBRA premiums for multi-millionaires. Now, Mr. Waxman, Mr. Chairman Waxman, you and your colleagues really don't want to do that. I know you don't. I mean, I know you have a lot of rich friends. It's silly. But the friends you have can support them.
You're one of them.
And they don't. What did he say? Honestly, I'd be glad to pay my own health insurance if I got fired from this job. I'm ready. But it's just not right to have your party to help these people that are making so much money, and to step in and say, okay, Mr. Taxpayer, from Ocala, Florida, from Okahumpka, Florida, from Micanopy, Florida, from Ocklawaha, Florida, and from Osceola, Florida, that you guys are going to have to pay the Madoffs of this world with these COBRA payments. I mean, my constituents like yours are having a very tough time, and you're asking me to tax them and say, okay, you want to pay these rich guys on Wall Street? It's not right. So if you make a huge amount of money, step up to the plate and pay for it, and don't ask the people of Okahumpka to pay it. So I hope you'll support my amendment. It prevents taxpayers from having to pay the health care bill of multimillionaires.
Mr. Chairman, I withdraw my reservation.
The chair recognizes himself. We have the problem of how you try to find out people's income, to set up a system to say whether they're going to be eligible for the COBRA help or not. Now, I would think that it shouldn't be as difficult to check if somebody's annual income is $1 million or more. And I don't know how that would be structured, but I'll agree to the amendment, and we'll see whether we can figure out a way to structure it.
Mr. Chairman, will you accept the amendment?
I'm willing to accept the amendment on the condition that we'll see if it could work. Okay. And if it can't work, we're not going to stay with it, but we'll give it a try.
Well, I think we just won one.
Well, we both can be outvoted. The question now comes on the Stearns Millionaire Amendment. All those in favor of the amendment say aye.
Aye.
Opposed, no. The ayes have it, and the amendment's agreed to.
Okay.
You take my name off the amendment, and things happen. Isn't that great?
The next one is a little weak, and it actually would kind of hurt the state of Florida.
We have no further amendments. Do we have any further amendments?
Oh, you betcha, Mr. Chairman.
Mr. Rogers.
Thank you. Yeah. Thank you, Mr. Chairman. Oh, I'm sorry. I have an amendment at the desk. It's amendment number 39.
Mr. Chairman, I reserve a point of order.
Mr. Stearns.
Who reserved the point of order? Gentleman from Texas reserved a point of order.
And I was upset, Julie, because it's a fabulous amendment.
There you go.
You better quit while I'm ahead.
Amendment offered by Mr. Rogers. In Title III, at the end of the amendment added by Section 3003A2, add the following. EE1, effective October 1, 2009, notwithstanding any other provisions
I would move
of this
that the amendment
title.
be considered read.
Without objection, the amendment's considered as read. There is a reservation for a point of order from the gentleman from Texas and gentleman from Michigan. Mr. Rogers is recognized for 2 minutes.
Thank you, Mr. Chairman. This legislation creates a way for states to extend health care coverage to unemployed workers through their Medicaid program. And at the same time, it also recognizes that premium assistance is important in the COBRA plan. While it's important to assist unemployed workers with health coverage during a recession, if we're going to do it, we must provide them with meaningful access to health care. My amendment would require states to give unemployed workers more options. It would offer premium assistance so unemployed workers can purchase a high-quality health plan that meets their needs. For many states, including Michigan, access to Medicaid doesn't always mean access to good health care. State Medicaid programs are underfunded and provide fewer benefits, meaning doctors see fewer patients. There is no more heart-wrenching call you will get in your office from somebody who has finally gone through the process to get on Medicaid and cannot find a doctor to take them. Government-run health care programs simply can't provide the same high-quality health care found in the private market, and they can't keep pace with reimbursement rates. By giving unemployed workers the option of choosing a plan on the private market, we're giving patients better access to services, better plan benefits, and ultimately better health outcomes. And it will incentivize doctors to take Medicaid patients, which is absolutely critical as our unemployment rates start to creep up. Mr. Chairman, I fear for the upcoming debate on health care reform if this amendment fails. Is it the goal of health reform to flaunt that you have covered everyone but ignore the broken Medicaid model? Or is it the goal to provide everyone the opportunity to have affordable and equally important accessible health care? The majority has already acknowledged that premium subsidies work. You've done it in the COBRA plan. Let's do this for the Medicaid patients who are eligible so that they can have the private health care option to buy in to make sure that doctors take them. In states that have unemployment like Michigan at 10.6%, that's right, 10.6%, this is crucial for them to continue to receive quality health care, and I would urge you, Mr. Chairman, to accept the amendment.
Gentleman's time has expired. The chair recognizes himself in opposition. This is not like COBRA, where people can take their group plan and get and pay for it and keep it and maybe get some help so they don't have to pay their share and the employer's share. What the gentleman's amendment would do is to give people on Medicaid, a little amount of money and tell them to go out and buy a private policy. Well, they're not going to be able to get a private. They're not going to be able to get a private group policy. They're going to have to get a private insurance policy. And if they have a disability, if they have a chronic illness, nobody's going to give them a policy, especially for the amount of money they're going to get under a premium support, as the gentleman would outline it. This undermines the whole idea of making sure that we have a benefit package that will be available to people under Medicaid. Many states choose to cover those people under various kinds of managed care settings, and even through private managed care situations. But to give them a premium and then tell them to go shop around for a policy is maybe they'll buy a policy that will only cover some of their needs, but not much more than that. So I would strongly oppose this amendment. I urge my colleagues to...
Will the gentleman yield?
Chairman, I withdraw my point of order.
The gentleman withdraws his point of order. Mr. Pallone, yield to you on this.
Well, thank you, Mr. Chairman. The other thing I would argue is that, states have the flexibility now that if they want to do this, they can. I just don't want to put them in a straitjacket. Right now what we're really trying to do is make sure as many people are covered as possible. And many states might find that, this kind of premium assistance program is just going to bog them down and make it more difficult for them to move ahead and cover everybody under regular Medicaid. So, I think we have to give the states the flexibility. We shouldn't require this. They can do it if they want to, but don't force them to do it.
Will the gentleman yield? 15 seconds.
Gentleman recognized for 15 seconds.
Thank you, Mr. Chairman. Two quick points. It's voluntary, and you put no income test in here. So if you have the means, you should be able to do it. There's no income test. You could you lose your job, get on Medicaid. You could actually have a reduction in your benefits when you might be able to afford a plan. Just give them the option to do that. You're removing that option from literally hundreds of thousands of workers. When you come from a state like Michigan, you're excluding a whole bunch of people from even getting access.
But we're not removing it. They still have the option. Your amendment would require it, and I think that.
And they're not going to have an option available to them if it's in a private insurance market. All time has expired on this amendment. All those in favor of the Rogers Amendment will say aye. Aye. Opposed, no. No. The noes have it. The amendment's not agreed to. Gentleman requests a roll call vote. Clerk will call the roll.
Mr. Waxman. No. Mr. Waxman, no. Mr. Dingell. Mr. Dingell, no. Mr. Markey. Mr. Boucher. Mr. Pallone. Mr. Pallone, no. Mr. Gordon. Mr. Rush. Ms. Eshoo. Ms. Eshoo, no. Mr. Stupak. No. Mr. Stupak, no. Mr. Engel. No. Mr. Engel, no. Mr. Green. No. Mr. Green, no. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Ms. Harmon. Ms. Harmon, no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Gonzalez, no. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross. Mr. Weiner. Mr. Weiner votes no. Mr. Matheson. Mr. Butterfield. Mr. Butterfield votes no. Mr. Melanson. Mr. Barrow. Mr. Barrow votes no. Mr. Hill. Mr. Hill votes no. Ms. Matsui. Ms. Matsui votes no. Mrs. Christensen. Mrs. Christensen votes no. Ms. Castor. Ms. Castor votes no. Mr. Sarbanes. Mr. Sarbanes votes no. Mr. Murphy of Connecticut. Mr. Murphy of Connecticut, no. Mr. Space. Mr. Space, no. Mr. McNerney. Mr. McNerney, no. Ms. Sutton. Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Barton? Mr. Barton votes aye. Mr. Hall? Mr. Upton? Mr. Stearns? Mr. Stearns, aye. Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Shimkus? Mr. Shadegg? Mr. Shadegg votes aye. Mr. Blunt? Mr. Blunt votes aye. Mr. Boyer? Mr. Radonovich? I'm sorry. Mr. Boyer votes aye. Mr. Radonovich votes aye. Mr. Pitts? Mr. Pitts votes aye. Ms. Bono Mack? Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy of Pennsylvania votes aye. Mr. Burgess? Mr. Burgess votes aye. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey votes aye. Mr. Scalise? Mr. Scalise, rather. Anyone here? Mr. Markey? Votes no. Mr. Rush? Mr. Rush votes no. Mr. Hall? Mr. Hall votes aye.
Other members wish to respond? Any members wish to respond to the vote that have not yet done so?
Okay.
Mr. Ross.
Mr. Ross. Mr. Ross votes no. Mr. Melanson votes no. Mr. Melanson. Yeah, I got him the first time.
Anyone else wish to respond to the vote? Clerk will tally the vote.
Mr. Chairman, on that vote, the ayes were 14, the nays were 31.
14 ayes, 31 noes. The amendment's not agreed to. Are there further amendments to this
Mr. Chairman.
title?
Mr. Chairman.
Who's seeking recognition?
Mr. Chairman.
Yes, Mr. Stearns.
Mr. Chairman, I have an amendment at the desk, amendment number 7.
Reserving a point of order.
Gentlelady from Colorado reserves a point of order. The clerk will report the amendment and please have it distributed.
Amendment offered by Mr. Stearns. In section 3003B2, strike, quote, 100%, unquote, and insert, quote, 50%.
Amendments before us. The gentleman from Florida is recognized for 2 minutes.
Thank you, Mr. Chairman. I'd like to direct this amendment to Mr. Pallone, who is the subcommittee chair of health, and just have sort of a talk with him. Your Governor Corzine and my Governor Chris probably would want 100% administrative costs. I agree. All I'm saying, keep the status quo. That is, when it comes to reimbursing states for administrative costs, make sure the states have something in the game, some skin in the game, some money in the game, so that they're involved too. And also make sure the federal government has some say-so when we're trying to drive down cost for Medicaid. So my amendment returns what is in the bill to what the status quo is. It forces the states to share 50% of administrative cost of Medicaid buy-in program. And when you look at this, if it was our money and the states came to us and said, we want you to pay all the Medicaid cost for our citizens of the state, we say yes. And then we say we also implement the program through administrative costs, and we want you to pay all of those too, 100%. I said, well, wait a second. If I pay all the administrative costs and I pay all the costs for the health care for your citizens, what are you doing? The state has no responsibility. So, Mr. Pallone, I would just ask common sense that maybe I can convince you, like I convinced Mr. Waxman last time, to consider keeping the status quo. You and I have been up here about 20 years, you and I together, each, and we've seen this program at 50% administrative costs. Why take it up to 100%, in which the federal government loses control of it, with no direction to the states to drive down costs? And lastly, the incentives for the state are such that they're just going to ask for more and more money. So I ask for a yes vote on this.
Gentleman's time has expired. Mr. Pallone,
I withdraw my reservation, Mr. Chairman.
Reservation point of order is withdrawn. Mr. Pallone, do you wish to be recognized in opposition?
Yes, Mr. Chairman. I would just say to my colleague from Florida, you know, I look at this strictly from the point of view of the uninsured and the people that are suffering because of the recession. I'm not really that concerned about anybody but them. And I would be fearful that whether it's Florida, which I guess has an increasing unemployment rate, or New Jersey, where unemployment rate isn't as bad, but in both cases and in all the states, they have large budget shortfalls. And if we don't provide 100% funding and you make them pay either administrative or some kind of cost sharing, the likelihood is that they're just not going to cover these people, and the people are going to be uninsured and all the problems that stem from that. So I think we're just trying to be realistic here and saying that we want to cover people who are uninsured. We know the numbers are growing because of the recession, and the best way to ensure that, to make sure that that happens, is to pay 100% of the cost. So that's why I would oppose it.
Gentleman yield. I also would urge opposition to this. The states don't have the ability to pick up these additional costs. That's why we have an FMAP program in the bill. But for a 2-year period, while we go through this deep recession, we want the states to use the option to cover these unemployed, uninsured people. And we're not going to be able to create a whole new way to provide that care, so we'd rather use the state's Medicaid mechanism. So we'll make these people eligible. That's why we have 100% funding in it. It wouldn't work without it. This is only for 2 years. Let's do something to stimulate the economy by having health care provided for unemployed, uninsured people. And I urge opposition to the amendment. All time has expired on the amendment. All those in favor of the Stearns amendment will say aye. Aye. Opposed, no. No. The noes have it. The amendment's not agreed to. Are there further amendments? You want a roll call? You really want a roll call?
I think if they're going to ask roll calls, it ought to be meaner in the debate.
Okay. Other amendments to this section?
Mr. Chairman.
Mr. Deal.
I have an amendment at the desk, number 35.
Mr. Chairman, I reserve a point of order.
Clerk will report the Deal amendment, and we'd like to ask that amendment be distributed.
Amendment offered by Mr. Deal. In subsection DD4 of Section 1902 of the Social Security Act, as added by Section 3003A2, strike subparagraph A and insert the following. A, individuals described...
Without objection, the amendment will be considered as read. The gentleman from Georgia, Mr. Deal, is recognized for 2 minutes. Mr. Deal?
Yes.
Oh, okay.
I was being told that it was drafted based on the original print rather than the committee substitute, but I understand that that is acceptable and that would be a technical correction if it were adopted. Okay. Thank you, Mr. Chairman. Okay. This is an amendment that deals with the section of the bill of people who are unemployed being able to buy into and become eligible under Medicaid. Now, this does not require any asset or income test in order to be able to do it. And the federal government, under this legislation, would be required to pay 100% of the individual's cost who are enrolled under this program. Now, I would hope that you would take the same approach with the millionaire amendment we dealt with earlier as it related to COBRA. This is a millionaire amendment as it relates to Medicaid. And it simply says that if you have income of more than $1 million, that you would not be eligible to come under a government 100% paid for federal government program providing you with Medicaid coverage. I find it somewhat ironic that the legislation does not have built into it either an asset or an income test as a qualification requirement. This would provide at least a partial cap on who would be considered eligible.
We did the $1 million.
Mr. Chairman, I withdraw my reservation.
Has the gentleman from does the gentleman from Georgia, Mr. Deal, yield back the balance of his time?
Would yield to Mr. Barton.
Ask to put a statement in the record in support of the amendment.
Without objection, such.
I would yield back.
The chair will recognize himself in opposition to this amendment. I want to emphasize let me do this right. I want to emphasize that the economists and the nonpartisan experts from Treasury have told us it is nearly impossible to guess what newly unemployed people's income will be. The whole point of the temporary Medicaid insurance coverage option is to build on an existing program that will get temporary assistance to uninsured individuals quickly. So we want to streamline the enrollment process. 1,050,000, 100, there's an arbitrary amount, but it's going to set up an unnecessary barrier if we have any income test for Medicaid coverage. And I know it's going to be hard to justify this compared to what we agreed to before on COBRA, but I think when you talk about this Medicaid, you're talking about people who have lost their jobs, they're getting unemployment insurance, they may be even getting food stamps, their income and assets are going to be pretty low, and I don't think we ought to put a barrier in the way of getting them covered right away on a 2-year program under Medicaid by establishing something that would take probably years to figure out what the appropriate way would be to enforce it. So I would oppose the amendment.
Would the chairman yield?
Yes.
As the chairman knows, Medicaid programs now currently have an asset test in order to determine eligibility. It seems ironic that the poorest of the poor are subjected to an asset income test to get on the Medicaid rolls, but under this exclusion, we could have a millionaire who would not even be asked the question and would be able to get on the rolls with 100% federal expenditure. I just think that this is an oversight in the original bill.
Reclaiming my time, it's a theoretical issue you raise. I think it's highly unlikely that you're going to find millionaires who would like to go on Medicaid, and we're talking about people who while there may be some aberrations, they're not going to be the upper income strata, and we don't want to burden the whole system from moving forward for 2 years to cover them and let the states cover them without setting up a whole new bureaucracy for those individuals. I oppose the amendment. All time has expired. All those in favor of the Deal amendment will say aye. Aye. Opposed, no. No. The noes have it.
I'd ask for a recorded vote, Mr. Chairman.
Gentlemen, ask for a recorded vote. The clerk will call the roll.
Mr. Waxman.
No.
Mr. Waxman, no. Mr. Dingell. Mr. Dingell votes no. Mr. Markey. Mr. Boucher. Mr. Pallone. Mr. Pallone votes no. Mr. Gordon. Mr. Gordon, no. Mr. Rush. Ms. Eshoo. Ms. Eshoo, no. Mr. Stupak. Mr. Stupak, no. Mr. Engel. Mr. Engel, no. Mr. Green. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Ms. Harmon. Ms. Schakowsky. Ms. Schakowsky votes no. Mr. Gonzalez. Mr. Gonzalez, no. Mr. Inslee. Mr. Inslee, no. Ms. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Barrow votes aye. Mr. Hill? Mr. Hill votes no. Ms. Matsui? Ms. Matsui votes no. Mrs. Christensen? Mrs. Christensen votes no. Ms. Castor? Ms. Castor votes no. Mr. Sarbanes? Mr. Sarbanes votes no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Barton? Mr. Barton votes aye. Mr. Hall? Mr. Hall votes aye. Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Shimkus? Mr. Shattuck? Mr. Shattuck, aye. Mr. Blunt? Mr. Blunt, aye. Mr. Boyer? Mr. Boyer, aye. Mr. Radonovich? Mr. Pitts? Mr. Pitts votes aye. Ms. Bono Mack? Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy of Pennsylvania, aye. Mr. Burgess? Mr. Burgess, aye. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Markey come in? Mr. Boyer? Rush is not here. Green? Green is not here, right? No green. No.
Any members wish to respond to the vote that have not done so already?
On that vote, Mr. Chairman, then there were 13 ayes and 27 noes.
13 ayes and 27 noes. The amendment's not agreed to. Are there further amendments to this title? If not, the vote comes on the amendment in the nature of a substitute as amended. All those in favor, if it was amended, it was. All those in favor of the amendment in the nature of a substitute as amended will say aye. Opposed, no.
No.
The ayes have it. The motion now comes on reporting out the committee print as amended. All those in favor say aye. Aye. Opposed, no.
No.
The ayes have it.
Mr. Chairman, on that, I would ask for roll call vote.
We'll have a roll call vote on reporting this print.
That title, yes.
On this title.
Yes, sir.
All those in favor vote aye. All those opposed vote no. Clerk will call the roll.
Mr. Waxman? Mr. Waxman, aye. Mr. Dingell? Mr. Dingell, aye. Mr. Markey? Mr. Boucher? Mr. Pallone? Mr. Pallone, aye. Mr. Gordon? Mr. Gordon, aye. Mr. Rush? Ms. Eshoo? Ms. Eshoo, aye. Mr. Stupak? Mr. Stupak, aye. Mr. Engel? Mr. Engel, aye. Mr. Green? Ms. DeGette? Ms. DeGette votes aye. Mrs. Capps? Mrs. Capps, aye. Mr. Doyle? Ms. Harmon? Ms. Harmon, aye. Ms. Schakowsky? Ms. Schakowsky, aye. Mr. Gonzalez? Mr. Gonzalez, aye. Mr. Inslee? Mr. Inslee votes aye. Ms. Baldwin? Ms. Baldwin, aye. Mr. Ross? Mr. Ross, aye. Mr. Weiner? Mr. Weiner votes aye. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, aye. Mr. Melanson? Mr. Melanson votes aye. Mr. Barrow? Mr. Barrow votes aye. Mr. Hill? Mr. Hill votes aye. Ms. Matsui? Ms. Matsui, aye. Mrs. Christensen? Mrs. Christensen, aye. Ms. Castor? Ms. Castor, aye. Mr. Sarbanes? Mr. Sarbanes, aye. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, aye. Mr. Space? Mr. Space, aye. Mr. McNerney? Mr. McNerney, aye. Ms. Sutton? Ms. Sutton, aye. Mr. Braley? Mr. Braley, aye. Mr. Welch? Mr. Barton? Mr. Barton, no. Mr. Hall? Mr. Hall, no. Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal, no. Mr. Whitfield? Mr. Shimkus? Mr. Shattuck? Mr. Shattuck votes no. Mr. Blunt? Mr. Blunt, no. Mr. Boyer? Mr. Boyer, no. Mr. Radonovich? Mr. Pitts? Mr. Pitts votes no. Ms. Bono Mack? Mr. Walden? Mr. Walden, no. Mr. Terry? Mr. Rogers? Mr. Rogers votes no. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy of Pennsylvania, no. Mr. Burgess? Mr. Burgess, no. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey votes no. Mr. Scalise? Mr. Rush? Mr. Rush votes aye. Mr. Green? Mr. Green votes aye.
All members responded to the roll. Clerk will announce the vote. Do you have Mr. Markey?
No, sir. Mr. Markey?
No.
Mr. Markey
you want to
votes.
vote aye.
I'm sorry, both times.
Mr. Markey votes aye. Okay. On that vote, the ayes were 32 and the nays were 12.
32 ayes, 12 noes. The motion is agreed to. I ask unanimous consent that the staff be authorized to make technical and conforming corrections to this title and any previous title that we've already adopted today. Our last title is committee print regarding the state Medicaid fiscal relief. Without objection, the committee print will be considered as read. Clerk will designate section 1 to open up the amendment process. Just say Section 1.
Title V, Medicaid Provisions. Section 5000, Table of Contents of Title.
The chairman has an amendment in the nature of a substitute, and I ask unanimous consent to consider the amendment as read and as base text for the purpose of amendment. And without objection, amendments drafted to the committee print regarding Medicaid fiscal relief are made in order to this amendment in the nature of a substitute. This amendment contains a minor change to the text. It adds a Section 5007 that would temporarily raise the Medicaid dish allotments for all states in fiscal years 2009 and 2010 by 2.5% each year. Majority and minority staffs have been provided with the text of the amendment and a brief summary of the changes, as well as a CBO estimate. The title is a temporary response to the double whammy. The New York Times described it today on a survey of 40 states. It finds that Medicaid enrollment is growing rapidly. In some cases, the surge has overwhelmed social service agencies, and the states are being asked to meet this demand exactly at the time as the recession is driving down their revenues. This draft will give the states additional assistance under with their Medicaid costs for the period October 1, 2008 through December 31, 2010, when hopefully we'll be through the worst of the recession. Under the text as amended, all states will receive a 4.9 percentage point increase in their federal matching rate, or FMAP. States with high unemployment will get an additional increase designed to give the most help to the states with the largest increases in unemployment, and no state's regular matching rate can go down. The Texas amendment also included additional changes that will help state Medicaid programs during this recession. It would extend the current moratorium on Medicaid regulations for an additional 3 months to give the Obama administration enough time to dispose of them through notice and comment rulemaking. If these regulations are allowed to go into effect, state Medicaid programs will lose $200 million in federal Medicaid funds in just 3 months, and states simply can't afford it. It would extend existing Medicaid work transition provisions until December 31, 2010. It would give states the option of covering family planning services for uninsured low-income women who are not otherwise eligible for Medicaid. This is a critical prevention initiative that actually saves both the state and federal government money by helping to reduce the number of unwanted births. It would protect Indian Medicaid beneficiaries from cost sharing when they receive care from an IHS or tribal hospital. It would require both the Centers for Medicaid and Medicaid Services and the state Medicaid and CHIP agencies to consult with tribes when making policy decisions that affect them. And finally, the bill would temporarily raise the dish allotment for each state in fiscal year 2009 and 2010 by 2.5% in each of those years. CBO estimates the cost of these provisions at $89.5 billion over 5 years, and given the size of the Medicaid crisis states are facing, these seem like a modest response. So the amendment in the nature of the substitute is before us, and I will call on members who wish to offer amendments to this title. Are there amendments?
Mr. Chairman.
Mr. Boyer.
Mr. Chairman, I have an amendment at the desk. It would be amendment number 47.
Mr. Chairman, reserving a point of order.
The gentlelady from Colorado reserves a point of order. This is the Boyer amendment number 47, did you say?
And yes, Mr. Chairman.
Clerk, and without objection, that amendment will be considered as read. Gentleman is recognized for 2 minutes.
Thank you. My amendment adds value to the preventive health care mechanisms in the bill before us today by providing new pharmaceutical access protections for Medicaid beneficiaries taking antidepressants, antipsychotics, anticonvalescents, immunosuppressants, anti-cancer drugs, and HIV/AIDS drugs. These are the 6 protected classes identified in Medicare and heretofore referred to as the 6 protected classes of drugs. Back in 2005, when the committee worked on the Deficit Reduction Act, we adopted an amendment almost identical to this amendment which I offer today. All of my Democrat colleagues on the committee and 9 of my Republican colleagues supported this amendment. Specifically under my amendment, the State Drug Utilization Review Board must determine, based on standards of practice and the strength of scientific evidence, that limiting access to the 6 protected classes of drugs is not likely to harm patients or increase the overall medical costs. These drug utilization review boards are defined under current law and must have health care professionals who have recognized expertise in appropriate prescribing, drug use review and evaluation, quality assurance, and other matters. The boards must be composed of at least 1/3 practicing physicians and at least 1/3 practicing pharmacists. My amendment additionally ensures that Medicaid patients have access to the medicines that they need if they do not hear back from the drug utilization boards within 24 hours by providing patients with up to a 30-day supply of their needed medications. Currently, Medicare regulations specifically require prescription drug plans to provide access to, quote, all or substantially all, end quote, medicines for treatment of these 6 protected classes. While Medicare beneficiaries are protected, we have no protection for Medicaid beneficiaries. So 3 years ago, that's what I sought to do, was to bring consistency between the 2 programs. I think what we did was the right thing when we adopted this in Medicare Part D. My amendment works to ensure that the same protections are afforded in Medicare beneficiaries are given to Medicaid beneficiaries. Currently, there are virtually no federal protections for Medicaid beneficiaries on how states administer their prior authorization programs. In contrast, Medicare regulations currently require all new drugs in the 6 protected classes to be reviewed by pharmacy and therapeutic committees. These committees, like the drug utilization review boards that I described earlier, are required to be composed of practicing physicians and practicing pharmacists to incorporate the best philosophies when determining whether to approve the drugs. So to illustrate...
Gentleman's time has expired. You want to just conclude?
Yes, I will. My amendment, Mr. Chairman, I've been told is really at a no-cost score. It does not prohibit prior authorization. It merely requires Medicaid programs to examine the best science and medical literature in making these decisions. I seek continuity, consistency, and good patient health outcomes by bringing these 2 programs together, Mr. Chairman.
Mr. Chairman, I withdraw my reservation.
The gentlelady from Colorado withdraws her reservations. The chairman recognizes himself for 2 minutes. I supported the gentleman when he offered this amendment. I'm very sympathetic to what you're trying to accomplish. My concern is that this may have a cost impact, and we don't know what that cost impact would be if we adopted the amendment as a change in the Medicaid program here in their pharmaceutical area. And it also gets complicated because Medicaid has a best price provision, and I don't know how that would impact that particular provision. So I'm going to oppose it now, but I certainly want to work with the gentleman in the future to see how we can make this work. I just don't think this legislation is the appropriate vehicle for such a change because of all these complicating factors.
Will the gentleman yield?
Yes.
I would like to work with the chairman. It's been 3 years, and it's been a lot of pain trying to see what's happening when we have the 2 systems here treating patients differently. What's hard for us here is that we don't get the benefit of dynamic scoring. So take mental health patients, for example, where these drugs are very fragile. And you could have a schizophrenic or a mental health patient. They all respond differently to different drugs. And if you're too restrictive, it can cause increased social costs, harm to individuals, family members, innocent, increased judicial costs. So I would agree with the chairman. There's a lot at stake here. And what the chairman just mentioned is why I was not successful in a House-Senate negotiation 3 years ago.
Well, I want you to succeed all the way through on this provision because I understand the consequences of it. Let me request of you that you withdraw the amendment. If we can figure out something now, we'll do it. But if not, I think we need to revisit this whole issue of pharmaceutical coverage under Medicare and Medicaid. Yes.
In that spirit, to work with me so we can bring these programs together, I'll work with the chairman or work with Chairman Pallone to make this a reality. Based on that, I'll withdraw my amendment.
I thank the gentleman very much for his withdrawing the amendment. The amendment was withdrawn. Are there further amendments to this title? Mr. Rush.
Mr. Chairman, I have an amendment that I'm going to introduce. However, I am going to withdraw the amendment. Mr. Stupak and I have sponsored H.R. 444 to make critical improvements to the 340B drug discount program.
Well, the gentleman has an amendment. We'll consider it read and distributed. The gentleman is going to be recognized to explain the issue, and as I understand it, is going to withdraw the amendment thereafter.
I will.
The gentleman is recognized for 2 minutes.
Mr. Chairman, Mr. Stupak and I have introduced H.R. 444, and our legislation would extend the discount to inpatients and expand eligibility to the program, the 340B program, for a number of rural hospitals. And I want to emphasize to the committee 3 reasons why we believe these changes are so important for low-income patients and why we believe this legislation should be included in the stimulus legislation. First, the current policy of providing safety net hospital discounts on life-saving drugs provided to vulnerable outpatients but not vulnerable inpatients, even for the same exact drug, makes absolutely no sense policy-wise. This amendment will rectify this problem by allowing safety net hospitals to utilize the 340B discount for all patients that they serve, whether the patient is in a low-income clinic or admitted as an inpatient. Second, our legislation will enable small rural hospitals to also be able to utilize the 340B discount for their patients, absolutely essential to expanding access to drugs in economically distressed rural areas. Thirdly, our 340B legislation will help to stimulate the economy by providing savings to states and savings to safety net hospitals for the benefit of the vulnerable, low-income, and uninsured patients for whom 340B discount is provided. Mr. Chairman,
Gentleman, yield to me. Oh. No, I didn't mean to interrupt you. I wanted you to yield to me.
All right, Mr. Chairman, I want to recognize yield the balance of my time to Mr. Stupak.
Without objection, gentlemen, be given an additional minute.
Mr. Chairman, I'll be very brief, and I thank Mr. Rush for introducing this legislation. The discounts to the 340B program are quite significant. On an average, it's about 40 to 50% less than the average wholesale price. However, the 340B program is only for outpatient drugs. As a result, hospitals have to pay an average 25% more for drugs given to patients that are admitted to the facility to stay overnight. Not only does this result in higher pharmaceutical costs, but then the hospitals have to maintain 2 pharmacies and 2 pharmacy inventories. Mr. Rush's legislation will not solve our health care woes, but goes a long way towards ensuring that safety net hospitals in this country can continue their mission of providing health care to all patients, regardless of their ability to pay. It's a good common sense, cost-saving measure.
Mr. Rush, if you yield to me, I want to express to you my strong willingness to work with you and Mr. Stupak on this issue. I think the high price of drugs is an important issue for this committee's consideration, and just the example of what we've done for those who have been on Medicaid and switched over to Medicare, I think it's costing us a couple $2 billion a year. Same drugs, same people, just a couple $2 billion more in costs. And if we could get the lower price to some of these institutions, it would mean a lot of savings for them as they're providing care for very low-income people. So I want to pledge to you to work with you further on this, but not in this bill, in some other legislation later this year.
I want to thank you, Mr. Chairman, and with that, I withdraw the amendment.
Without objection, the amendment's withdrawn. Are there further amendments to this title?
Mr. Chairman.
Who's seeking recognition? Mr. Pitt?
I have an amendment at the desk. It's Amendment 045.
Mr. Chairman, reserving a point of order.
Gentlelady from Colorado reserves a point of order. The clerk will report the amendment, and we'd ask that the amendment be distributed.
Amendment offered by Mr. Pitts. In Title V, add at the end of the section 1920C of the Social Security Act, added by Section 5004B, the following. D, parental notification requirement. 1, in general, subject to paragraph 2, in each case that a qualified...
Without objection, the
determines
amendment
that
will be considered as read. I'm going to recognize the gentleman for 2 minutes to talk about his amendment. Mr. Pitt.
Thank you, Mr. Chairman. I really don't understand what the expansion of family planning services has to do with stimulating the economy. But my amendment has to do with parental notification in this section for minors. Subsection EE establishes criteria for individuals who are eligible to be beneficiaries of the new state option established in Section 5004. The criteria includes a new loophole to permit surreptitious enrollment of minors of virtually any family income level in this program without the knowledge of the parents or consent of the parents. Instead of helping loving parents protect, nurture, or raise their children, this bill, as currently drafted, would keep parents in the dark. It is unconscionable that clinics leave parents in the dark while their children receive medication that may be detrimental to their health or even deadly. Parents know their children's medical history. Parents are best able to make medical decisions for their minor daughters, and parents should be informed when their child is given prescription medicine. I'll just cite one example, the story of Melissa, a teenage girl who had a terrible reaction to a contraceptive drug after she received it without her parents' knowledge. And when they found her vomiting and screaming for help, her parents had no idea that she could be reacting from this drug. She was rushed to the emergency room where she was treated for reaction to this drug. There's a reason why school nurses have to get permission before administering Tylenol to kids, and why parents have to consent for piercings and tattoos. Parents know their kids best, and they're best equipped to help them make good decisions. And when parents are knowledgeable about their children's health care, they can protect their daughters from sexual abuse and predators. Nearly all children and teenagers will qualify for this program under the current language. As this bill expands family planning coverage to minors, the least we can do is make sure their parents are notified. My amendment would ensure that parents are informed and able to be a part of their child's medical decisions, and I urge my colleagues to support.
Would the gentleman yield?
Yes, I'll be good.
I know the time's expired. I have a statement I'd like to put in the record, and I rise in strong support of the gentleman's amendment. It's one of the more important amendments that we're considering this evening.
The time has expired. The statement that the gentleman from Texas wishes to insert in the record will be permitted without objection.
Mr. Chairman.
Now, Ms. DeGette, do you wish to be recognized in opposition?
Chairman, I withdraw my reservation, and I seek time in opposition to the amendment.
We only have 2 minutes, and I know Ms. Capps wishes to speak on it as well, so I hope in the course of managing the 2 minutes in opposition, you would yield to her.
Absolutely, Mr. Chairman.
Gentlelady is recognized for 2 minutes.
Mr. Chairman, I'll just point out a couple of things. Number one, there's no current requirement under Medicaid for parental notification for contraception. Number two, this is contraception, not abortion. And I will remind my colleagues on both sides of the aisle once again, if we want to prevent abortion, we should have contraception. While most adolescents will consult with their families about contraception, unfortunately, this does not always happen. And I will finally point out, Mr. Chairman, that while a number of states require parental notification in some circumstances for contraception, there is not one state in this country, and again, not under Medicaid, do states require parental notification for all adolescents to receive contraception. This is just incredibly broad, and it will be detrimental to the health of the young women of America. With that, I will yield to Ms. Capps.
I thank my colleague for yielding. Mr. Chairman, I believe it's essential to retain the underlying language which establishes a state option for covering family planning services. My state of California has received this waiver for a long time and has tremendously positive results for the patients who benefit. Every year, California's family planning program serves 1.5 million clients and saves the state $2 billion. In answer to Mr. Pitt's question, how does this save the economy? For every dollar spent on this program, California saves $2.76 in medical and social services costs within 2 years. In 2007, CBO estimated savings of $200 million over 5 years and $400 million over 10 years for a state option to cover Medicaid family planning services for all women who would be eligible for pregnancy-related care. It not only saves money, it's a good health care practice. So I urge my colleagues to support retaining the language to oppose this amendment and to make coverage of family planning services a state option. And I return any unused time to my colleague.
Chairman, yield back.
All time has expired on the amendment. All those in favor of the Pitts amendment will say aye.
Mr. Chairman, I'd like a roll call vote.
You want a roll call vote? Let's go right to a roll call.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingell? Mr. Dingell, no. Mr. Markey? Mr. Boucher? Mr. Pallone? Mr. Pallone, no. Mr. Gordon? Mr. Rush? Mr. Rush, no. Ms. Eshoo? Ms. Eshoo votes no. Mr. Stupak? Mr. Stupak, aye. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green, no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross votes aye. Mr. Weiner? No. Mr. Weiner votes no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Barrow? Mr. Barrow votes no. Mr. Hill? Mr. Hill, no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Barton? Mr. Barton? Mr. Barton votes aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Shimkus? Mr. Shattuck? Mr. Shattuck, aye. Mr. Blunt? Mr. Blunt? Mr. Blunt votes aye. Mr. Boyer? Mr. Radonovich? Mr. Pitts? Mr. Pitts votes aye. Ms. Bono Mack? Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Rogers? Mr. Rogers votes aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania votes aye. Mr. Murphy votes aye. Mr. Burgess? Mr. Burgess votes aye. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey votes aye. Mr. Scalise? Mr. Markey? Mr. Markey?
No.
Mr. Markey votes no. Mr. Gordon.
Any other members wish to respond to the roll?
Mr. Melanson. Mr. Melanson votes aye.
Mr. Welch? Mr. Welch?
Mr. Welch votes no.
If there are no other members who wish to respond to the vote, the clerk will tally the vote.
Sounds right. On that vote, Mr. Chairman, the ayes were 14 and the nays were 29.
14 ayes, 29 noes. The amendment is not agreed to. Further amendments to this title?
Mr. Chairman.
Mr. Deal.
I have an amendment at the desk, 2A.
Clerk will report the amendment and have it distributed.
Amendment to the committee print offered by Mr. Deal. Add at the end of Title V the following.
Reserve a point of order.
Gentlelady from Colorado reserves a point of order. Without objection, the amendment will be considered as read, and the gentleman from Georgia, Mr. Deal, is recognized for 2 minutes.
Thank you, Mr. Chairman. As many of you recall, I raised the issue of pricing transparency in health care during proceedings we had this past fall. I think that the issue of knowing what you're paying and what it's going to cost you should pertain in health care as it does in most everything else. If you're going to buy something, a good or a service, you generally know in advance how much it's going to cost. That is not true when it comes to health care. Some of you will recall the illustration I used of a young man who works here on the Hill who last year had to have an emergency appendectomy. There was confusion as to whether or not he had insurance coverage, and several weeks after he got home, he received a bill in the mail for $19,000 for a one-night stay. Finally, when it was clarified that he did have insurance, it was settled by the insurance company paying $2,100. With that kind of differential, is it any wonder that the #1 cause of personal bankruptcy in this country is the fact of medical bills that people simply cannot pay? What this amendment does is simply require hospitals that are receiving payments from Medicaid to publicly disclose the prices charged for the services to the uninsured and to self-paying patients. I think patients ought to have a right to know what they're going to be charged in advance and not be surprised by it after the fact. I would urge the adoption of this amendment, and I would yield back the balance of my time unless someone else wishes to claim it. I yield back.
Gentleman yields back his time. Mr. Pallone?
Mr. Chairman, I would like to respond in opposition. Mr. Deal has raised the issue of transparency, and particularly with hospital charge sheets and in other situations, and I'm sympathetic to that. But I just don't think that this is the time to do it. I mean, we really don't know whether this information is useful. It may just make it more difficult, I think, to move ahead with the legislation. I have said to him that, we certainly intend to have hearings in the subcommittee to address these transparency issues, and it's certainly something that could be done in the context of health care reform and the hearings that we would have on health care reform. But I think that right now it only serves to increase, possibly the burden on hospitals, and it needs to have a hearing and have more of an opportunity to see in what context we should do this. I don't think the information is necessarily going to be helpful to individuals right now without further investigation of the whole issue of transparency in this context. So I would urge opposition to the amendment, not because we disagree that these types of things need to be done, but I just don't think that this is the time to do it without further hearings and further investigation of it.
Would the gentleman yield?
Certainly.
Could you give me some indication as to when we might expect those hearings?
Well, we're going to have a series of hearings on the whole health care reform issue, and we can certainly raise this in the context, but I know we've been busy with the stimulus right now, so I don't have a time period. But I think it can be taken up in the context of health care reform.
Gentlemen, yield to me, Mr.
Certainly.
Malone. Well, I think you're absolutely right. When we do health care reform, we should look at what kinds of information will best enable consumers to make informed choices about their care. But I don't think the legislation we're debating today is the right place for this kind of an endeavor. But I would join you in pledging to Mr. Deal that we're going to review it and we'll have a further opportunity to review the matter.
Will the chairman yield for a question?
It's Mr. Pallone's time.
Will the subcommittee chairman yield for a question?
I think my time's actually run out, Mr. Chairman.
I was just simply going to inquire from the minority standpoint if we could have some sort of timeline as to when to expect these hearings on health care reform, because many of the things you've discussed today will fit into that venue, and I think it's fair to keep us apprised as to what the plans
We certainly will.
are.
We certainly will keep everybody apprised of the schedule and the plans and want to discuss all these issues. All time has expired on this amendment.
Mr. Chairman, I withdraw my reservation.
Gentlelady from Colorado withdraws her reservation on a point of order. All those in favor of the Deal amendment will say aye. Aye. Those opposed will say no. No. The noes have it. The amendment's not agreed to.
Ask for a recorded vote.
The clerk will call the roll.
Mr. Waxman. Mr. Waxman, no. Mr. Dingell? No. Mr. Dingell votes no. Mr. Markey? No. Mr. Markey, no. Mr. Boucher? Mr. Pallone? Mr. Pallone votes no. Mr. Gordon? Mr. Rush? Mr. Rush, no. Ms. Eshoo? Ms. Eshoo, no. Mr. Stupak? No. Mr. Stupak, no. Mr. Engel? Mr. Engel, no. Mr. Green? Mr. Green votes no. Ms. DeGette? Ms. DeGette votes no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Barrow? Mr. Barrow votes no. Mr. Hill? Mr. Hill, no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch votes no. Mr. Barton? Mr. Barton votes aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal votes aye. Mr. Whitfield? Mr. Shimkus? Mr. Shattuck? Mr. Shattuck votes aye. Mr. Blunt? Mr. Blunt votes aye. Mr. Boyer? Mr. Radonovich? Mr. Pitts? Mr. Pitts votes aye. Ms. Bono Mack? Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Rogers? Mr. Rogers votes aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy, Pennsylvania, aye. Mr. Burgess? Okay. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey votes aye. Mr. Scalise. Mr. Burgess. Mr. Burgess votes aye.
Have all members responded to the roll? If no other member wishes to be recorded, the clerk will tally the vote.
He votes no, Mr. Mell? Okay. On that vote, Mr. Chairman, the ayes were 11 and the nays were 32.
11 ayes, 32 noes. The motion is, the amendment is not agreed to. Further amendments?
Mr. Chairman, I have another amendment at the desk. This is Amendment 51.
Without objection, the amendment will be considered as read, will be distributed,
Chairman.
and the gentleman from Georgia will be recognized, but before he's recognized, the gentlelady from Colorado wishes to reserve a point of order.
Thank you.
Gentleman from Georgia, Mr. Deal.
Did he recognize me?
Mr. Deal.
Oh, thank you, Mr. Chairman. I would like to call particular attention to this amendment. It is one that we have discussed in this committee before, and for those who are on the committee in the past, you have heard from your community pharmacists on this issue. For those of you who are new to the committee, I assure you, you will hear from your community pharmacists on the issues embodied in this amendment. This is an issue that I raised last year, and when I offered this amendment in legislation last year, I was persuaded by the Democrat majority to withdraw it on the condition that we would have a hearing and a bipartisan conference with pharmacists and other stakeholders in the pharmaceutical delivery industry. I am still waiting for that conference to be scheduled, and as you know, it has not happened. Now, there are three components to this particular amendment, and I would hope you would listen to them. One of them is that it deals with a provision that was put into regulations, and it was contrary to the intentions of this committee, and we've been unable to correct it. And that is in reimbursing the brick-and-mortar pharmacies, that is your community pharmacists, by removing the sales to from mail-order pharmacies from the calculation of the federal upper limit for generic drugs. And this amendment would separate that out and would also set a separate category for calculating the federal upper limit for mail-order pharmacies. Secondly, it would give the states the increased flexibility to reimburse pharmacists by increasing the federal upper limit on generic drugs from 250% of the lowest average manufacturing price, AMP, to 300% of the volume-weighted average of all AMP prices, which if any of you have familiarity with pharmacies, you know this is the fairer way to reimburse your pharmacist. And it also includes a provision that says that states cannot get this bonus money under Medicaid unless they are providing at least a dispensing fee of $9 per prescription for the multi-source prescription drugs, generics, in their Medicaid program. This committee passed out a provision that required a minimum of $8 dispensing fee as a part of the Deficit Reduction Act, but it was unfortunately not agreed to by the Senate. These are three provisions as it relates primarily to your community pharmacist, and I would urge you to pay attention to this one. I think it's important for all of us.
Gentleman's time has expired. Chair recognizes
Chairman,
himself in opposition. Gentlelady withdraws her point of order. I have a great deal of sympathy about this issue on reimbursement for pharmacies and the effect it has on access to prescription drugs, but this amendment creates several problems, and that's why I can't support its inclusion in the legislation. It says unless a state is able to pass a legislation quickly to establish a $9 dispensing fee, the state wouldn't be able to get a temporary Medicaid assistance program. Secondly, the enactment of this amendment would increase states' Medicaid costs, and this could adversely affect states and force cuts in other services during a time of fiscal distress. And it's unclear that requiring the same dispensing fee level in every state makes sense given the costs vary across and within states. I appreciate the gentleman's interest in looking into the issue of pharmacy reimbursement, but this is not the right vehicle for addressing this issue.
Would the gentleman yield?
And I would therefore have to
the gentleman yield for a brief moment?
Yield to the gentleman.
Mr. Chairman, I appreciate it, and I think the intent of the gentleman, and I think you're going to see many of us raising the subject of the challenges community pharmacies make. They are the ones that are getting squeezed in the vice that they have no way to get out of. I think everyone has some way to pass along costs. And this, I agree with you, this isn't probably the vehicle, and maybe this isn't the perfect amendment. But I think that perhaps, Mr. Chairman, if you would take it under advisement how many of us are concerned about the plight of community pharmacies, how many amendments that are coming over the transom in this bill, that maybe at some point, Chairman Pallone and yourself, we can try to come up with a strategy to help them, because they really are in desperate straits.
I think the gentleman makes an excellent point, and I certainly will want to work with you and urge that Chairman Pallone hold hearings on this question and see if we can address that problem. It's a real one. Chair yields back the balance of his 3 seconds. The vote now comes on the Deal amendment. All those in favor of the amendment say aye. Aye. Opposed, no. No. The noes have it, and the amendment.
Mr. Chairman, I would ask for a recorded vote on this one.
Clerk will call the roll.
Mr. Waxman. No. Mr. Waxman, no. Mr. Dingell. Mr. Dingell votes no. Mr. Markey. Mr. Markey, no. Mr. Boucher. Mr. Pallone. Mr. Pallone, no. Mr. Gordon. Mr. Rush. Mr. Rush, no. Ms. Eshoo. Ms. Eshoo, no. Mr. Stupak. Mr. Stupak, no. Mr. Engel. Mr. Engel, no. Mr. Green. Mr. Green, no. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Ms. Harmon. Ms. Harmon, no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Gonzalez, no. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Ross, no. Mr. Weiner.
So much for a form.
Mr. Weiner, no. Mr. Matheson. Mr. Butterfield. Mr. Butterfield, no. Mr. Melanson. Mr. Melanson, no. Mr. Barrow. Mr. Barrow votes no. Mr. Hill. Mr. Hill, no. Ms. Matsui. Ms. Matsui, no. Mrs. Christensen. Mrs. Christensen, no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes. Mr. Sarbanes, no. Mr. Murphy of Connecticut. Mr. Murphy of Connecticut, no. Mr. Space. Mr. Space, no. Mr. McNerney. Mr. McNerney, no. Ms. Sutton. Ms. Sutton, no. Mr. Braley. Mr. Braley, no. Mr. Welch. Mr. Welch, no. Mr. Barton. Mr. Barton, aye. Mr. Hall. Mr. Upton. Mr. Stearns. Mr. Deal.
Aye.
Mr. Deal, aye. Mr. Whitfield. Mr. Shimkus. Mr. Shattuck.
Aye.
Mr. Shattuck, aye. Mr. Blunt. Yes. Mr. Blunt, aye. Mr. Boyer. Mr. Radonovich. Mr. Pitts. Mr. Pitts votes aye. Ms. Bono Mack. Mr. Walden. Mr. Walden votes aye. Mr. Terry. Mr. Rogers. Aye. Mr. Rogers, aye. Mrs. Myrick. Mr. Sullivan. Mr. Murphy of Pennsylvania. Aye. Mr. Murphy of Pennsylvania, aye. Mr. Burgess. Aye. Mr. Burgess, aye. Ms. Blackburn. Mr. Gingrich. Mr. Gingrich, aye. Mr. Scalise.
Other members wish to respond to the vote?
Mr. Hall.
Aye. Aye.
Mr. Hall votes aye.
Any other members wish to be recorded? If not, the clerk will tally the vote.
On that vote, Mr. Chairman, the ayes were 11 and the nays were 32.
11 yes, 32 no. The amendment's not agreed to. Chair would inquire how many further amendments we have.
Mr. Chairman, I think if all our members are here or awake, we have 4 more amendments. Maybe 5, but I think 4.
Okay, I hope we don't need a roll call vote on all of them, but we'll do what we have to do.
I can go stir them up if you want a little energy.
To that point.
So who is next in seniority? Mr. Shattuck.
Mr. Chairman, I will not ask for a roll call vote if you will stipulate to a show of hands to try to be accommodating for the hour. And I do have an amendment at the desk. It's amendment number 054.
Mr. Chairman, I reserve a point of order.
The amendment is before us. Without objection, it will be considered as read. The gentlelady from Colorado has reserved a point of order on the amendment. And while it is being distributed, the gentleman from Arizona will be recognized for 2 minutes.
Thank you, Mr. Chairman. The essence of being an American is choice. We all enjoy the choice of being able to pick what kind of car we buy, what kind of shoes we buy, all of the thousands of choices, whether we buy a name brand aspirin or a generic aspirin, all those types of decisions. Everyone in this room, at least sitting at this dais, gets to make choices about their health care. The essence of my amendment is simply to say that Americans on Medicaid should have some level of choice. We all enjoy some degree of control in our own lives, and I think it's important to give people on Medicaid some degree of control in their own lives. In the base legislation, we're going to add nearly $100 billion additional dollars to Medicaid. There are people currently receiving Medicaid benefits who are eligible for employer-sponsored group health care but can't afford to pay for it. And I believe we should give them choice. I think we should say to them that you have the ability to make 2 choices. In many of the great programs that this government has established, I would cite, for example, the food stamp program. We do not say to American citizens who need help financially in buying the groceries they need, here are the foodstuffs you get, take these specific foodstuffs and nothing else. We don't require them to go to a government cafeteria. Instead, we provide them with a voucher, and we say to them, take this and go buy the food you want. In the Medicaid program, there are many critics of it and many proponents of it, but there are people in this country who could, if given the possibility, purchase a program through additional financial assistance of their choice. And I think we ought to give them that choice. Earlier you said, Mr. Chairman, in discussing a similar issue, that they might buy coverage less than they would get under current Medicaid programs. If you will notice in the language we've written, we've said that this would allow them to exercise that choice, but only to purchase a policy that had benefits equal to and coverage equal to or better than the Medicaid benefits offered by their state. In the discussion of that matter, Mr. Pallone said that he was concerned about the difficulties of states in offering this option to people who get Medicaid benefits. My concern is what Mr. Pallone said later, and that is he felt that under programs of this nature, our number one concern ought to be the recipient of the benefit. I don't really care if it's a little bit more difficult for states to say you can get Medicaid or you can keep your employer-sponsored care and we'll pay a little bit toward the difference. I think the focus ought to be on choice, and I think it ought to be doing the best we can for the individual. And so I would urge the adoption of this amendment to give that choice to people on Medicaid.
Time has expired. Mr. Pallone.
Thank you, Mr. Chairman. Well, again, as I said before, in a similar context, states have the option of doing these premium assistance programs now if they think that they're beneficial and that they think that they can get, people that are Medicaid eligible to find that option. But oftentimes the option doesn't exist because, the individual market is very difficult. And I just don't want to put a straitjacket on the states that they have to set this up as a condition to get their FMAP benefit, because it could theoretically slow the process down. And we're just looking for a quick way to get health coverage for those who are uninsured. So again, the flexibility is there if the states want to do it, but if they decide that it's not a good way to operate, given that we're trying to have a quick fix here to get people covered, I don't think we should force them to do it and require it. So I would oppose the amendment.
Gentlemen, yield. In other words, you will allow the states to have a choice. And if states don't want to do this, they don't have to. And this amendment by Mr. Shadegg says the states have no choice. They have to do it his way, or they can't get any money under FMAP.
Exactly.
Would the gentleman yield?
Sure.
I guess I understand that it might impose an additional burden on the state, yet in a different context, you said, in response to a comment by Mr. Deal, that the number one concern ought to be with the recipient of the benefit, not with the design of the program. The number one concern...
If I could take back my time, my number one concern, as I said before, is that we get people who are uninsured insured. And so I say that in the context of the easiest way to get as many people insured as possible. And if a state feels that this is going to be a roadblock, then I don't want to put that roadblock in the way, because then that would make it more difficult for people to get insured. So it's a different context the way you're saying. I think it's important to get as many people insured as possible. If the states feel that this is a good way to do that, fine. But if they don't and they think it's going to be a hindrance, I think that we shouldn't put them in a straitjacket.
Gentleman's time has expired.
Chairman, I withdraw my reservation.
The reservation by the gentlelady from Colorado is withdrawn. All those in favor of the amendment will raise your hand. And the clerk will count the hands. Only one per person.
How are you?
And all those opposed to the amendment, please raise your hand. Clerk will announce the tally.
On that vote, there were 9 ayes and 26 noes.
9 ayes, 26 noes. The amendment is not agreed to. Further amendments?
Mr. Chairman.
Who's seeking? Oh, Mr. Murphy from Connecticut.
Thank you, Mr. Chairman. I don't have an amendment. I just want to engage with the chairman in a short colloquy on the underlying substitute language.
Gentleman is recognized.
Mr. Chairman, I'd like to thank you and the drafters of this bill for including language that protects beneficiaries of Medicaid programs by requiring states that accept this FMAP increase to maintain their levels of eligibility with regard to their Medicaid programs. I think that's incredibly important because, as we know, the first place that states go when they're looking for savings when faced with budget shortfalls is often that Medicaid line item. The bill specifically gives them the latitude to change the benefit packages, but it's largely silent on the issue of rates. And, Mr. Chairman, I just have a fear that though the states will be constrained on the issue of eligibility, that they may use the latitude to decrease rates to the point of effectively throwing people off of the Medicaid rolls because they don't have access to providers. The existing statute has a requirement to say that rates have to be sufficient, this is quoting from the statute, to enlist enough providers so that care and services are available under the plan, at least to the extent that such care and services are available to the general population. And my question to you, Mr. Chairman, is just that is this committee's intent that states are still bound by that requirement and that we're going to ask and expect the new administration through HHS and CMS to hold states to that standard in the underlying law regarding rates?
If the gentleman will yield, I appreciate you bringing this issue to our attention. It is the intent of this committee that states receiving increased FMAP payment must comply with the letter and spirit of existing law in maintaining provider payment levels. In addition, the committee will carefully watch states' reactions to this legislation and will try to ensure that states do not use this increased federal match to constrict provider payment levels below the requirements of current law.
I thank the chairman very much for his attention to this issue, and for that response, and I'd also ask that the committee maybe look into some further oversight on this issue, so as states go through their budget processes this spring and summer, that we make sure that they aren't going against, as you said, both the spirit and intent of the underlying law and rates.
I thank the gentleman, and I think you've raised a good point. We'll look forward to working with you on it.
Thank you. Yield back balance of my time.
Further amendments on the bill, Mr. Stupak.
Thank you, Mr. Chairman. It's Stupak 001. Mr. Chairman, I ask unanimous consent that the amendment be considered as
Clerk
read.
the clerk will report the amendment, and without objection, it will be considered as read. And the amendment will be considered as read, and the gentleman's recognized.
Mr. Chairman, I would reserve a point of order.
And the gentleman from Georgia reserves a point of order. Mr. Stupak is recognized for 2 minutes.
Thank you, Mr. Chairman. As you know, I've introduced legislation in previous Congresses that would apply the Medicaid fee-for-service drug rebate to drugs prescribed under Medicaid managed care. I've worked with the states, safety net providers, health plans, and patient advocates to ensure that this language protects health plan enrollees, generates savings to the federal and state governments, and protects government programs from abuse. This amendment reflects common sense policy that the Congressional Budget Office said would save the federal government $11 billion over 10 years. Furthermore, the amendment provides immediate critical fiscal relief to states at the time in this economic downturn. These are savings that could be used to prevent tax increases or cuts in benefits or services in education, healthcare, or transportation. The Medicaid drug rebate ensures that state-run Medicaid programs receive the best price for prescription drugs for their Medicaid beneficiaries. Despite my belief that this amendment will provide significant fiscal relief to our struggling states and that it enjoys widespread support, I will withdraw my amendment. I want to be clear about why I'm withdrawing this amendment. It's not because I don't believe this bill can stand on its own. But quite frankly, Mr. Chairman, I'm very concerned about by what I see as disproportionate influence by pharma, the drug manufacturers. How is it that we always seem to make cuts to hospitals, doctors, and rural providers, but never ask the drug manufacturers to bear their share of the burden? Mr. Chairman, it's my sincere hope that this concern over the drug manufacturers' bottom line is not going to set the mood for our deliberations over the next 2 years. And with your assurances, Mr. Chairman, I look forward to working with you in the coming months to address the concerns that you have regarding this legislation. It's my hope that we find agreement on this legislation in order to move this important legislation. With that, Mr. Chairman, I ask unanimous consent to withdraw my amendment.
The gentleman, before he withdraws the amendment, will yield to me. I want to give him such assurance that we will work together on this issue. It's a matter that concerns both of us and many other members of the committee. Without objection, the gentleman withdraws the amendment.
Thank you, Mr. Chairman.
Mr. Gingrey, you have an amendment?
Mr. Chairman, I have an amendment at the desk on behalf of Mr. Stearns, amendment number 4.
Chairman, I reserve a point of order.
Gentlelady from Colorado reserves a point of order. The amendment is considered as read without objection and will be distributed to the members. In the meantime, Mr. Gingrey will be recognized for 2 minutes to speak in favor of the amendment.
Mr. Chairman, thank you. We have heard it mentioned a number of times tonight, objection to certain amendments over concern about slowing the process down. I certainly hope that this fairly simple but important amendment, the majority would agree that this was one that it's worth slowing the process down over. It simply ensures that all applicants for the Medicaid program document their identity to ensure that states are actually implementing this important anti-fraud provision. This amendment prohibits the Secretary from distributing any funds under Section 5001, the temporary increase of Medicaid FMAP, to any state the Secretary finds is not in compliance with this identity verification requirement. Mr. Chairman, in order to encourage states to come back into compliance with this provision, non-compliant states would be given 30 days notice before any funds are withheld, and the states will be allowed to receive Section 5001 funds again as soon as they are found to be in compliance with this provision. This is no small problem, and I think my colleagues would agree with me. A number of states, I could name states, some as much as 10% of Medicaid spending is simply criminally fraudulent. In other states, 3% or more of enrollees in the Medicaid program were determined
to be illegal aliens or other non-qualified aliens. So quite honestly, let's slow down and make sure the verification of Medicaid eligibility is there in this emergency Medicaid program FMAP expansion. That, in essence, is my simple bill, and I hope I'll have support on both sides of the aisle. Mr. Chairman, I yield back.
Gentleman yields back his time. Mr. Pallone, recognize.
Thank you, Mr. Chairman. Again, this is going to put barriers in the way of a program that we're trying to address quickly. We know that a lot of people are becoming unemployed. The unemployment rates continue. People lose their health coverage as a consequence. And if you start to put these identity barriers in the way, it's going to be more difficult for them and more difficult for states to access the money so that they can provide the coverage. My understanding is that identity is even more difficult to prove than citizenship. And we have an example in one state, in Wisconsin, the one state that tracked data. 19,413 people were denied coverage or lost coverage in a 7-month period because they failed to meet the citizenship documentation requirements. These 2/3 actually provided proof of citizenship but not identity. So I mean, at a time when we're really worried about people losing their coverage, and the whole purpose of this is to try to quickly get them insured, I just think that these types of barriers are they're against the whole purpose of the bill.
I wish if the subcommittee chairman would yield for a second.
Sure.
Yeah, I just say to Mr. Pallone, I mean, I know in the state of Georgia, my people would say it'd be cruel and unusual not to identify, and I would hope the people in New Jersey would feel the same way. And
it's
often,
here
again, this rush to
if I could reclaim, it's often difficult for people to prove their identity. And then the other thing, what I don't understand is that if you use someone else's identity, then you're going to obtain treatment under that person's name and health history. I mean, it seems like who would even want to do that?
Gentleman yield.
Well, very likely somebody who's not eligible.
It's Mr. Pallone's time. In Wisconsin, they tracked the data, and they said 19,413 people were denied coverage or lost their coverage in a 7-month period because they failed to meet the citizenship documentation requirement. And of these, 2/3 actually provided proof of citizenship, but not identity. And I think that your time has expired, but I would join you in opposing the amendment. All time has expired.
I withdraw my reservation.
Gentlelady withdraws her reservation. All time has expired. All those in favor of this amendment say aye.
Aye.
Opposed, no. No. The noes have it, and the amendment's not agreed.
Mr. Chairman, on that,
show of hands.
I would respectfully like a recorded vote. Thank you, Mr. Chairman.
You want a recorded vote?
I do want a recorded vote.
Clerk will call the roll.
Mr. Waxman. Mr. Waxman, no. Mr. Dingell. Mr. Dingell.
Votes no.
Mr. Dingell votes no. Mr. Markey. Mr. Markey, no. Mr. Boucher. Mr. Pallone. Mr. Pallone, no. Mr. Gordon. Mr. Rush. Mr. Rush, no. Ms. Eshoo. Ms. Eshoo, no. Mr. Stupak. Stupak, no. Mr. Engel. Mr. Engel, no. Mr. Green.
No.
Mr. Green, no. Ms. DeGette.
No.
Ms. DeGette, no. Mrs. Capps.
No.
Mrs. Capps, no. Mr. Doyle. Ms. Harmon.
No.
Ms. Harmon, no. Ms. Schakowsky.
No.
Ms. Schakowsky, no. Mr. Gonzalez.
No.
Mr. Gonzalez, no. Mr. Inslee.
No.
Mr. Inslee votes no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Weiner. Mr. Matheson. Mr. Butterfield. Mr. Butterfield votes no. Mr. Melanson. Mr. Barrow. Mr. Barrow votes no. Mr. Hill. Mr. Hill votes aye. Ms. Matsui. Ms. Matsui, no. Mrs. Christensen. Mrs. Christensen, no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes. Mr. Sarbanes, no. Mr. Murphy of Connecticut. Mr. Murphy of Connecticut, no. Mr. Space. Mr. Space, aye. Mr. McNerney. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley votes no. Mr. Welch? No. Mr. Welch, no. Mr. Barton? Mr. Barton votes aye. Mr. Hall? Mr. Hall? Mr. Hall votes aye. Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal votes aye. Mr. Whitfield? Mr. Shimkus? Mr. Shattuck? Mr. Shattuck votes aye. Mr. Blunt? Mr. Blunt votes aye. Mr. Boyer? Mr. Radonovich? Mr. Pitts? Mr. Pitts votes aye. Ms. Bono Mack? Mr. Walden? Mr. Walden votes aye. Mr. Terry? Mr. Rogers? Mr. Rogers votes aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy of Pennsylvania votes aye. Mr. Burgess? Aye. Mr. Burgess, aye. Ms. Blackburn? Mr. Gingrey? Mr. Gingrey, aye. Mr. Scouts? Here.
Any member wish to respond to the vote? Roll call that has not yet responded.
Mr. Ross? Aye. Mr. Ross votes aye.
Any further votes? If not, the clerk will tally the vote.
Mr. Chairman, on that vote, the yeas were 13 and the nays were 20. I'm sorry, the yeas were 13 and the nays were 26.
13 ayes, 26 noes. The amendment's not agreed to.
14 ayes, 26.
14 ayes, 26 noes. The amendment's not agreed to. Further amendments?
I have one final amendment that I have. It's
is it the final amendment or
it
just
is,
your
it
final
is
amendment?
my final amendment. It's number 52.
Gentlemen,
Reserve point of order.
Gentleman from Georgia, Mr. Deal, has an amendment at the desk. The gentlelady from Colorado reserves a point of order. The amendment will be considered as read, and the gentleman is recognized for 2 minutes.
Thank you, Mr. Chairman. This relates to an issue that we have dealt with just recently, and that is under the S-chip bill. Under current law, if an individual is allowed and permitted to come into this country as an immigrant, it has been the requirement that they agree as a condition that, first of all, they will have a sponsor, and secondly, that that sponsor will be responsible for them for a 5-year period, and that they will not immediately go on to our welfare or social service roles. This bill removes that 5-year requirement. Now, I know that you're going to say, well, we voted to do that last week in the S-chip bill, and it is true that it was done in the S-chip bill. But I would remind you that last week, the S-chip bill came to the floor of the House without coming through any committee, without any opportunity to amend it in a committee, and came to the floor with a closed rule with no opportunity to amend it on the floor. And therefore, if you voted for the S-chip expansion and this was a part, I'm sure you might be able to say to your constituents who ask you, why is it that you now want the American taxpayer in a time of recession to take on responsibility for people who said they wouldn't go on our welfare rolls for 5 years, and now you want to put them on there? Well, that was just a part of a larger S-chip bill. I'm going to give you the opportunity to vote on this as a freestanding issue with this amendment and make it clear to your constituents whether you do or don't agree that people who are allowed to come into this country should not be allowed to immediately go into the Medicaid rolls. And if you do agree that they should not be allowed to go immediately and should be required to be self-sufficient or to be covered by their sponsor, then I would hope that you would vote for the amendment.
Chairman, I withdraw my reservation.
Gentlemen's
time is up.
Time has expired. Chair will recognize Mr. Pallone.
Let me just say, Mr. Chairman, I will say what Mr. Deal said I was going to say, which is that we just voted on this in the SCHIP bill, and the reason that we did is because it makes sense. I mean, people are here legally. We're only talking about legal immigrants now, under all different circumstances. Some have sponsors, some don't. You know, they can be here in a variety of situations. But the bottom line is it doesn't make sense for them to have to wait 5 years to have coverage. I mean, what does that mean? They don't have coverage. They delay care. They end up going to the emergency room, which costs us even more money, sometimes 10, 100 times what it would cost for them to be able to go to a doctor. It doesn't really make sense to say that if someone's here legally, that they should not be provided coverage, because it's just in the long run going to cost us more money. So I would ask that we oppose this, and I would yield to the gentleman from Texas.
Thank you, Mr. Chairman, and I thank our chair of our subcommittee for yielding to me. Mr. Deal is right that last week the SCHIP bill passed, and it's a state option. That's just what this bill does. If the state doesn't want to do that, then they have that option. But there are states who may want to, and following up what Mr. Pallone said, that these folks just don't come into the country and get on SCHIP for their children or Medicaid. These are folks who are laid off and have the option to take this if the state allows it. And again, like Mr. Pallone said, the children would, families would be waiting in the waiting room at an emergency room because they lost their insurance because of their employment. And again, it's a state option, and that's why I urge a no vote on the bill or the amendment.
Gentlemen,
go ahead.
Gentlemen, yield. Go ahead.
Otto was asking for time, or did I miss? No.
Mr. Gett?
Thank you, Mr. Chairman. I just wanted to point out it's especially ludicrous to talk about a 5-year exclusion when you talk about children, because if children had to wait for 5 years, then they wouldn't get the treatment they need at all. Thank you.
Same applies to a pregnant woman. 5-year wait for a pregnant woman makes no sense at all. It's stupid and it's morally wrong. Gentlemen's time has expired. The vote now comes on this amendment. Mr. Deal, how do you want to proceed?
I'd like a recorded vote.
Okay, let's call the roll.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingell?
No.
Mr. Dingell, no. Mr. Markey? Mr. Markey, no. Mr. Boucher? Mr. Pallone? Mr. Pallone, no. Mr. Gordon? Mr. Rush? Mr. Rush, no. Ms. Eshoo? No. Ms. Eshoo, no. Mr. Stupak? No. Mr. Stupak, no. Mr. Engel? No. Mr. Engel, no. Mr. Green? No. Mr. Green, no. Ms. DeGette? No. Ms. DeGette, no. Mrs. Capps? Mr. Doyle? Ms. Harmon?
No.
Ms. Harmon, no. Ms. Schakowsky?
No.
Ms. Schakowsky, no. Mr. Gonzalez?
No.
Mr. Gonzalez, no. Mr. Inslee? Mr. Baldwin? I'm sorry, Ms. Baldwin? No. Ms. Baldwin, no. Mr. Inslee?
No.
Mr. Inslee, no. Mr. Ross?
No.
Mr. Ross, no. Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? No. Mr. Butterfield, no. Mr. Melanson? Mr. Barrow? Mr. Barrow, no. Mr. Hill? No. Mr. Hill votes no. Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor?
No.
Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy of Connecticut, no. Mr. Space? Mr. Space, no. Mr. McNerney? Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, no. Mr. Barton? Mr. Barton votes aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Stearns? Mr. Deal? Mr. Deal votes aye. Mr. Whitfield? Mr. Shimkus? Mr. Shattuck? Mr. Shattuck votes aye. Oh, there he is. Mr. Blunt? Mr. Blunt votes aye. Mr. Boyer? Mr. Radonovich? Mr. Pitt? Mr. Pitts votes aye. Ms. Bono Mack? Mr. Walden? Mr. Walden votes aye. Mr. Terry? Mr. Rogers? Mr. Rogers votes aye. Mrs. Myrick? Mr. Sullivan? Mr. Murphy of Pennsylvania? Mr. Murphy votes aye. Mr. Burgess? Mr. Burgess votes aye. Ms. Blackburn? Mr. Gingrey? Gingrey votes aye. Mr. Shelley's? Shelley.
It's not going to cost me.
He's not here.
All members responded to the roll. Call the roll.
Mr. McNerney? No. Mr. McNerney votes no. Mrs. Capps?
Votes no.
Mrs. Capps votes no.
Clerk will tally the vote.
On that vote, Mr. Chairman, the ayes were 11 and the nays were 31.
11 aye, 31 no. The amendment is not agreed to. Further amendments? Seeing none.
Mr. Chairman,
Deal.
I'd like to move to strike the last word briefly to have a colloquy with you.
Gentleman's recognized.
I had two amendments that were prepared, and I did not offer them, and I would simply ask the chairman if he would take a look at the issues that they would have raised, and I'll be very brief. One is that we have in the past appropriated a permanent annual funding for investigating fraud in the Medicaid system of $25 million. That is now stripped out of that bill after 1 year. I personally believe that we need, with all the bad stories we've heard in the past about fraud in the Medicaid system, we need a permanent fraud funding source that the states can count on. I would ask the chairman if he would take a look at that. The other amendment would have increased or sped up the process of electronic verification of assets by 2 years. We currently have the law that says it will be in place by 2013. This would have reduced that down to 2011. It would save billions of dollars if we have that in place under CBO scoring. Your state, I understand, is going to have that in place by the end of the fiscal year and be able to do that. I would ask you if you would consider those two issues, and if you have a manager's amendment, if they have merit, I would ask you to include them.
Gentlemen, we yield. I certainly will look at those issues and want to work with you on them. We need to do all we can to stop any wage fraud and abuse in this and all other programs before us. Any further amendments to this title? We do have a resolution of the Blunt amendment that we're working on in a previous title, and I would ask unanimous consent that the Blunt amendment, number 1, as amended, be agreed to and inserted in the appropriate place in Title IV. Mr. Blunt, do you want to say anything?
I thank the chairman for taking time to work through this. I just want to express appreciation to Ms. Eshoo and Mr. Gett for believing that we could work this out, and to you, Mr. Markey and Mr. Pallone, for being willing to take the time to work it out. Certainly Mr. Weiner and Mr. Ross, who understands these pharmacy issues better than any of us, were helpful in working with the staff, and the staff worked hard to find language out of other regulations that they think clarify this amendment in the way it was intended. And I thank the chairman for the time we were able to take to get this done, and hope to see it included.
Mr. Blunt, we certainly will press for this compromise. There are other parties that have to agree to it because other committees have jurisdiction, but I think it's a good compromise, and we'll certainly do all we can to see it included in the bill. Without objection, that unanimous consent request is agreed to. The vote now comes on, in this title, the amendment in the nature of a substitute as amended. All those in favor of the amendment in the nature of a substitute as amended will say aye. Aye. Opposed, no. The ayes have it, and the amendment's agreed to. Vote now comes on reporting the committee print as amended. All those in favor will say aye. Aye. Opposed, no. The ayes have it, and the motion's agreed to.
Mr. Chairman, on that, I would like to
let me ask unanimous consent that staff be authorized to make technical and conforming corrections. Mr. Barton requested a roll call vote on final passage of this title. You really want that? We're not asking for a roll call vote on the whole package.
We did that on every other title except one that I forgot.
Okay. Well, the gentleman requests it. Let's go through another roll call vote. This will be the last roll call vote that we'll have this evening, and before members scamper out of here, I want to extend my gratitude to everybody who stayed in what has been a 12-hour since our committee first was convened on both sides of the aisle. The patience and tenacity of all of you to work this through is very much appreciated and important for all of us. Especially also want to thank the Republicans for working with us to expedite the process of this bill by agreeing to time limits in consideration of amendments. We will now conclude this last title by a roll call vote. All those in favor of reporting the title out as amended will say aye. Those opposed will say no.
Mr. Waxman.
Aye.
Mr. Waxman, aye. Mr. Dingell.
Aye.
Mr. Dingell, aye. Mr. Markey.
Aye.
Mr. Markey, aye. Mr. Boucher. Mr. Pallone. Mr. Pallone, aye. Mr. Gordon. Mr. Rush. Mr. Rush, aye. Ms. Eshoo. Ms. Eshoo, aye. Mr. Stupak. Mr. Stupak, aye. Mr. Engel. Mr. Engel, aye. Mr. Green.
Aye.
Mr. Green votes aye. Ms. DeGette.
Aye.
Ms. DeGette, aye. Mrs. Capps.
Votes aye.
Ms. Capps, aye. Mr. Doyle. Ms. Harmon.
Aye.
Ms. Harmon votes aye. Ms. Schakowsky.
Aye.
Ms. Schakowsky votes aye. Mr. Gonzalez.
Aye.
Mr. Gonzalez votes aye. Mr. Inslee. Mr. Inslee votes aye. Ms. Baldwin. Ms. Baldwin votes aye. Mr. Ross. Mr. Ross, aye. Mr. Weiner. Mr. Weiner, aye. Mr. Matheson. Mr. Butterfield. Mr. Butterfield, aye. Mr. Melanson. Mr. Melanson votes aye. Mr. Barrow. Mr. Barrow, aye. Mr. Hill. Mr. Hill votes aye. Ms. Matsui. Ms. Matsui, aye. Mrs. Christensen.
We have had a long day.
Mrs. Christensen, aye. Ms. Castor. Ms. Castor, aye. Mr. Sarbanes. Mr. Sarbanes, aye. Mr. Murphy of Connecticut. Mr. Murphy of Connecticut, aye. Mr. Space. Mr. Space votes aye. Mr. McNerney. Mr. McNerney votes aye. Ms. Sutton. Ms. Sutton votes aye. Mr. Braley. Mr. Braley. Mr. Braley votes aye. Mr. Welch. Mr. Welch votes aye. Mr. Welch votes aye. Mr. Barton. Mr. Barton votes no. Mr. Hall. Mr. Hall votes no. Mr. Upton. Mr. Stearns. Mr. Deal. Mr. Deal votes no. Mr. Whitfield. Mr. Shimkus. Mr. Shattuck. Mr. Shattuck votes no. Mr. Blunt. Mr. Blunt votes no. Mr. Boyer. Mr. Radonovich. Mr. Pitts. Mr. Pitts votes no. Mrs. Bono Mack. Mr. Walden. Mr. Walden votes no. Mr. Terry. Mr. Rogers. Mr. Rogers votes no. Mrs. Myrick. Mr. Sullivan. Mr. Murphy of Pennsylvania votes no. Mr. Burgess. Mr. Burgess votes no. Ms. Blackburn. Mr. Gingrey. Mr. Gingrey votes no. Mr. Scalise.
Have all members responded to the call of the roll? Then the clerk will tally the vote.
On that vote, Mr. Chairman, the ayes were 32, the nays were 11.
32 ayes, 11 noes. The motion's agreed to. I would now call up H.R. 629, and without objection, the text of H.R. 629 will be struck after Section 1 and replaced with the text of the 5 committee prints the committee approved as amended at today's business meeting, and the committee will order reported to the House H.R. 629. Any objection? Without objection, that will be the order. The chair will also call forward H.Res. 31, sponsored by Mr. Price from North Carolina. This measure expresses support for the designation of January 28, 2009 as National Privacy Day, and I'd ask unanimous consent that the committee approve this measure and order it reported to the House.
We have no objection.
Without objection, that will be the order. That concludes our business. We stand adjourned. Oh, Mr. Barton.
We would ask that the minority has the usual 2 business days to prepare minority views on the bills that have just been reported.
Without objection, that will be the order.
Thank you, Mr. Chairman.
That concludes our business. We stand adjourned.
Yeah. Yeah.
This is